Okay, great. Thank you for letting me know, Johanna. Okay. I'm waiting for confirmation on Facebook. Okay. Chair Sabatier, I think we are ready when you are. Jake, is everyone in?
Yeah, looks like we're ready to rock.
Excellent.
I could see Sam working on it. All right, I can hear my voice now. So everything's ready to go according to Sam, Jake, and Johanna? Yes? All right, let's go ahead and begin. It is 9:01 a.m. Today is May 11th, 2021. Just went back in time here. This is a regular board meeting for the County of Lake Board of Supervisors, and we will start with a moment of silence. Is there a moment of silence from any of our board members? And so since today we are going to do proclamations for military appreciation and law enforcement, I just want to take a moment to thank all of the military personnel and law enforcement personnel who have lost their lives in serving their country, and have appreciation and gratitude for what they do to keep us safe. Supervisor Simon, would you please lead us in the Pledge of Allegiance?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much, Supervisor. Item number 4, consideration of extra items not appearing on the posted agenda. Are there any extra items from board or staff? Okay, seeing none, let's go ahead and move on to the approval of the consent agenda. Are there any items to be pulled by board members? So I did want to pull item, let me make sure I have the right ones here, 5.3, 5.4, 5.5, and 5.7. And if there are no other items to pull, let's go ahead and ask the public, is there any items from the consent agenda that you wish to pull for further discussion? If you are in the Zoom room, please press the button at the bottom of your screen to raise your hand, or if you're calling via telephone, dial *9 to raise your hand so I know that you wish to speak. I see none in the boardroom, and I see none in the Zoom room, so let's go ahead and take action on the other items.
Mr. Chair, I will move to approve items 5.1, 5.2, 5.6, and then 5.8 through 5.13. Does that get, I think that gets them all.
Yeah, that is correct, thank you.
Second.
I have a motion from Supervisor Simon and the second by Supervisor Scott. Johanna, if we could please get a roll call.
Okay, Supervisor Simon,
Yes.
Supervisor Crandall,
Aye.
Supervisor Scott,
Aye.
Supervisor Pyska,
Yes.
and Supervisor Sabatier.
Aye.
Thank you.
And we're just going to do a awkward pause for 5 seconds. And it'll be 9:05 a.m. And then we will go ahead and now begin our 9:05 a.m. item. public input. This is for anyone that has any public comments that is not related to an item on our agenda. You have 3 minutes to speak. If anyone has a public comment to make, please go ahead and step up to the microphone. And in the Zoom room, if you have a public comment to make that is not related to an item on our agenda, please go ahead and raise your hand as discussed earlier. We'll start in the boardroom first. Please go ahead and give us your first and last name.
My name is Steve Zaleski. I live on the Buckingham Peninsula in Kelseyville. I would like to take a minute to talk about the impacts of the drought on Buckingham's Marina. And for anyone who uses either the west or south shore of the lake as access to Clear Lake, I think you're aware that the marina is the primary access to the lake, both for the public, for the tourists, for fishermen, and it's also the site of the Sheriff's Department's primary access. Their office and their fleet is there, and they're in a central location, so it has important health and safety implications. At present, I think the Rumsey is somewhere around 0.77. Average depths in the marina are about 4 feet, with areas certainly 2 to 3 feet, and I believe the mouth of the marina is at this point somewhere between 3 and 3.5 feet. And it's estimated that during the summer, water levels will drop to 2 feet below Rumsey. What that means is average water depths in the marina will be 2 feet. There may be dry land at the mouth of the marina, and the economic impacts would be significant, both to local residents. I think there's something like 200 slips in the marina. Tourism, obviously, it's a primary access, probably the primary access. Also for fishermen, and I think the sheriff has mentioned that at this point they can't launch boats or get them out of the marina. Clearly, a dredging project is going to be critical there, and the costs of such a project would be far beyond the economic resources of the small family business that runs the marina, the Brados. Fortunately, the community has within it the skill set to deal with much of this issue. My company, Northwest Biosurvey, we do, if not most, maybe all, or a great many of the environmental reviews for projects that come to the board and planning commission for permitting. We are donating our staff time and resources to doing all the environmental review for the project. Other members, such as Peggy King, she has spent much of her career doing project management and permitting for homestake mines and others. She would be able to do much of the government liaison and permitting. Still, we would need our local board's support, particularly financially. Ideally, since this is such a significant public resource, and due to the economic implications on tourism and fishing, and the health and safety implications through the loss of Sheriff's Department's primary resource and access to the lake, ideally, we'd like to find a way to do some sort of matching funds with an understanding that this is a private marina, but with significant public benefits.
Sir, just want to let you know that you've reached your 3 minutes. If you can go ahead and finish it up.
Okay, sorry about that.
No worries.
I was going to set my watch. We would, at the very least, need the board's support in a resolution for getting state and federal funding grants to do this work. Thank you.
Thank you very much.
Good morning. My name is Peggy King, P-E-G-G-I-E, and I also live in Buckingham and enjoy using the lake frequently in our sailboat and our motorboat. And I had written, my husband and I wrote a letter to Supervisor Pyska about a month ago, and I had forwarded it to you all, and I don't know if you've had a chance to read it, but it basically outlines the purpose of the Brados Marina that it serves for the public, and my glasses are fogging up. So the sheriffs provide a very important service to the community, including safety education, search and rescue operations, accident investigations, respond to complaints of reckless vehicle, vessel operations, assistance to disabled vessels, on-water security presence, and mitigation of on-water hazards, including hazmat and navigation dangers, including debris removal. And I personally have had some pretty scary experiences out on the water, and am grateful that we have a sheriff boat patrol to provide rescue services and also keep motorists under control, especially those that choose to drink and drive. So as Steve said, I am willing to help to try and find a way to get a dredging project done at Brados. And I believe the marina is probably the only full-service marina that we have on Clear Lake, and it serves a great public benefit. As Steve mentioned, the cost for dredging is quite costly, and we figure probably a minimum of $1 million and maybe up to $2 million. And we're working on getting some preliminary numbers for that work. And we will need board support to move forward with trying to find funding, and maybe even with making some contacts with our legislators to see that if there's any additional funding related to drought and public health and safety. I know that there was a bill that was passed through a Senate committee recently in the amount of about $3.4 billion. It seems to be focused on water quality. And this project may not fit into that. However, I think that maybe the Department of Conservation or Boating and Waterways will have some additional funding, and I believe the federal government has also declared a drought emergency in the state. So my ask of the board is to be supportive of this dredging project and work with us as we move forward and try and get this work accomplished. Thank you.
Thank you. Any other public comment here in the boardroom? Again, on anything not related to the agenda. Please come on up. As soon as it gets cleaned up, it's your turn.
My name is Stephen Stalker. I request a moment of silence for Robert Carl Brado. He passed away a year ago, and I'm sorry, this mask is, he was a very prominent member of the community, and he's very, very much missed. Thank you.
Thank you.
Thank you.
Any other public comment? Okay, let me check in the Zoom room. Does not appear to be a hand up. So we will go ahead and close public comment and move on to our 6.2 item, 9:06 a.m., consideration of update on COVID-19. And I see that we have Dr. Bloom with us in the Zoom room. See if we can, there we go.
I am here. For some reason, my video is not working here. It says the host has stopped it, unfortunately. Oh, hold on 1 second.
There
we
we
are.
go. Welcome.
Hi, thank you very much. Good morning, Board of Supervisors. Good morning, Chairman. Thank you very much for allowing me to speak with you this morning about our COVID-19 response. As per usual, I'm going to give you a brief overview of how our cases are doing, our tier status, our vaccination rollout, and then I'm going to have Sarah, our epidemiologist, talk to us more in depth about the data and the demographics, and then I'll be discussing some other topics a little bit more in depth. So, without further ado, we are doing well with our cases. Our cases in the county remain low. They remain about level as they have been for the past few weeks. For the week of the 25th to the 2nd, we've had 17 cases, new cases in the county, which gives us a daily case rate of about 3.7 per 100,000. And our testing positivity is 2.2%. So that is slightly above last week. That's in the low orange tier metrics, but still quite good, and virtually flat for a county of our size. We are still quite far away in one metric to the yellow tier, as all of these other metrics are sort of teetering right on the edge of orange to yellow tier, and that metric is vaccination coverage. We are still far off of the state average for vaccination coverage, where the state is around 61% and the county is around 49% of the persons in the county receiving at least one dose of vaccination. So again, on June 15th, all of these tiers will disappear and we will move on to general recommendations. And as you need to stay in with tier metrics for at least 2 weeks to be within that tier, so we would have to have yellow metrics for 2 weeks to become yellow. Once again, I would anticipate staying in the orange tier for the rest of the next month until the tiers disappear in a month. As far as the vaccination status goes, we have a surplus of vaccine. We have all 3 vaccines, J&J, Moderna, and Pfizer. And so all 16 years of age and older in the county are eligible. And so I encourage people to get their vaccination if they have not done so. The age group from 18 to 49 is approximately 31%, at least partially vaccinated, and the age group of 65 plus is 59% vaccinated. Those are the 2 groups which I will focus on later because I believe that they are the 2 groups that require the most work to increase the vaccination numbers. But other than that, vaccination is moving along, and with that, I'm going to pass it over to Sarah for further numbers from this week, and then we'll dive back into the details.
Thank you, Dr. Bloom. Good morning, everyone.
Good morning.
I have just a brief update. Statewide, we continue to see good indicators, improving indicators. Testing statewide, that's the graph on the left, was stable from this week compared to last week. And the testing positivity is hovering right around 1% to 1.3%. So really positive news. Testing is stable right now, and testing positivity is at an all-time low. As is the daily case rate. So the most recent, these data were reported yesterday, 3.7 cases per 100,000 at the state level, all-time low really since the beginning of the pandemic. As Dr. Bloom shared, we remain in the orange tier based on metrics from April 25th to May 1st. The map shows you the 58 counties status as of last week. Today, this will be updated, and I suspect a few more counties moving into yellow. But we'll note that the majority of the state's population, 60%, currently are in a orange tier, indicating moderate transmission. In Lake County, this is the epi curve showing the number of new cases identified per week. So this week's metrics were based on this week of April 25th, when 17 cases were identified in the county. And for the week we just finished, the week of May 2nd, to date have identified about 10 cases. So I'm pleased to see that we've been relatively stable the last couple of weeks with fewer than 20 cases, which is really positive. Switching gears into vaccination coverage at the state level, about 63% of eligible Californians are at least partially vaccinated. And we can see by geography, there still remains a disparity. About 74% of people in quartile 4 at least partially vaccinated, compared to about 50% of people in quartile 1. So the state is focusing on communities with lower vaccination coverage, trying to increase coverage in quartile 1 and quartile 2. Over 27,000 people in Lake County are at least partially vaccinated. That's 52% of Lake County residents 16 years of age and older. 41% of people are fully vaccinated. I'll make a note here on the data. Previously, federal data was not integrated into the California Immunization Registry. I just got a note that it has been. So I will be confirming this with the state data team, but my understanding at the moment is doses administered through any federal programs, which would include IHS, should now be included. Again, I will confirm this, but wanted to note that because I'm reporting these slightly differently because of this notice that I received. So over half of the eligible population, it now has at least partial protection through the vaccine. And wanted to share, take a closer look at who has been getting their first dose since everyone over the age of 16 became eligible on April 15th. So that's what this slide shows. It shows Lake County residents who received their first dose between April 15th and May 7th. And that was over 2,500 people. And you can see the distribution by age group, by where they live, and that 52% of doses went to males. This doesn't, I want to just note what I think these data tell us and what they don't tell us. The question of vaccine hesitancy is hard to fully answer. So these data don't tell us that, but they do tell us over the last 3 weeks or so where people are, are getting their first dose. And so I think that's important to think about and look at your communities and see if you think there's opportunities to improve vaccine messaging in those places. What I do think is really important to note here, looking at vaccination coverage by combined zip codes, is that about each week, or about every week, we see about a 1 percentage point increase in these zip codes to 38% of people at least partially vaccinated, and now about 51% of people partially vaccinated in these zip codes. I think it's really, there's opportunities, particularly in zip code 95422, to really focus vaccination efforts, as that is one of the communities with the lower coverage right now. Though it is increasing steadily each week, it still remains lower than the county average. And I think that's in a large part due to the tiered system and eligibility to get the vaccine out as it was rolled out. But now that everyone is eligible, I think there's a great opportunity to target communities that didn't perhaps have it available to them since the beginning, and really work to increase that coverage, at least at to the county average. And I'll note here, we continue to see, again, relatively between Latinos and white non-Hispanic residents, sort of on par every week with the increase in coverage. So 42% of Latinos at least partially vaccinated, and 45% of white non-Hispanics at least partially vaccinated. And then lastly, noting vaccination coverage by age group. So an estimated 6% of people 16 and 17 years of age have gotten at least one dose. 31% of people 18 to 49, which is our largest age group here at about 22,000 people, are at least partially or fully vaccinated. 61% of people 50 to 64 and 59% of people over the 65 and older. I'll note that I think this is also a really important population here, the 65 plus. The increase in vaccination coverage among this group has really slowed in the last couple weeks, and there's still 41% of people, 41% of 17,000 people who have not had at least one dose. And so I think this is an important population because they may be higher risk due to their age and other factors, as I think this younger age group, where 31% of people have received at least one dose, is an important group and perhaps an opportunity to target as younger people become eligible for the vaccine. So I'll turn it over to Dr. Bloom to speak more about vaccination coverage. Thank you.
Oh, you're muted, Dr. Bloom.
Sorry about that. Thank you very much for the reminder. Thank you, Sarah. So just to go a little bit further into the details, again, the cases are going well. Last week, there were 17 new cases, which gives us a case rate of 3.7 per 100,000, which is actually the same as the state as it is currently. And our testing positivity was 2.2%, with the state hovering around 1 to 1.3%. So just minimally higher. It's really about the same considering the size of our county. So this is actually quite good news. This is very low. And so all I can say is keep it up, because we are doing well in this respect. As far as the tiers go, this level again is low orange tier, and we're hovering right around that line to move into the yellow tier with metrics, except for the vaccine coverage, which has to be within 5% of the state average. And as Sarah just said, and I misstated earlier as I was using data that was a little bit older, as we only get the data very shortly before the board meeting, the state vaccine coverage is actually at 63%, with at least one vaccine dose being given. And in Lake County, we are at 52%. I misstated before, I said 49. So we are at 52%. This work to increase the vaccination coverage to our goal, which is to be within 5% of the state average, and our overall goal, which is to be at 70%, will be certainly slower than it has been in the past, and it will be more difficult and targeted. So there's still plenty of work to be done, but our goal is still to be 70% of the population of Lake County to be vaccinated, and to be fully vaccinated, not just partially vaccinated. That would be if you have a 2 vaccine dose of either the Moderna or the Pfizer, that you do receive those 2 doses for your full vaccination coverage, and that is our goal. Regarding the tiers, once again, on June 15th, the tiers will go away. There will be further guidance from the state, but it's going to be in line with what we've already been doing with masking and distancing. But the actual red, orange, purple, yellow tiers will disappear. Speaking of that, there have been some changes from the state that I did want to talk about regarding masking, regarding distancing. Now that there is a good percentage of the state that is vaccinated, the CDPH, the Public Health Department for the state, on May 3rd have put out new guidance particularly broken down for those who are fully vaccinated and those who are not fully vaccinated. So I wanted to mention what these new state guidelines are. For those fully vaccinated, if you are fully vaccinated, again, and I want to be clear with the definition here, fully vaccinated is that you have received 2 vaccine doses if you have the Pfizer or the Moderna vaccine, and if you got the Johnson & Johnson vaccine, which is only 1 dose, then you have received your dose of the Johnson & Johnson vaccine, and you have given yourself 2 weeks for your body to be taught how to respond to COVID and have that vaccine disappear out of your body, but you have given your body time to learn and to protect yourself. So it's 2 vaccines or the Johnson & Johnson vaccine, and then 2 weeks after, and after that you're considered fully vaccinated. So if you are fully vaccinated and you are outdoors, then you do not need to wear a mask. The requirements of mask wearing for outdoors have gone away for fully vaccinated persons unless you are in a crowded environment, such as a festival, a large music venue with many people around, a street fair, something of that nature, sporting event. Then the recommendation is still masking in a crowded outdoor environment. But other than that, you do not need to wear your mask outside if you are fully vaccinated. If you are inside and you are fully vaccinated and you are with other fully vaccinated people and there is no one there that is unvaccinated, but it's all fully vaccinated people, then you also do not need to wear your mask and you do not have to maintain social distancing at all times if you are all fully vaccinated. Now, so just to repeat that, if you're inside with fully vaccinated people and you yourself are fully vaccinated, you do not need to wear your mask, you do not need to distance. If you choose to, that's fine, but this is the current state guidance. Now, if you are indoors and you are with people who are not vaccinated, so for example, if you were on public transit, if you are in a business, and you don't know if people around you are vaccinated or not, you still need to follow the guidelines, you still need to mask, you still need to remain socially distanced, as certainly you don't know the other people around you and their vaccination status. Now, I wanted to discuss if you are not vaccinated. If you are not fully vaccinated, meaning if you have only received 1 dose or it has not been 2 weeks yet after your 2nd dose of the Pfizer or the Moderna vaccine, then you are considered not fully vaccinated, and you still should be wearing face coverings while outside if you cannot distance yourself appropriately from other people. And then certainly the same would go for if you're in a crowded situation, like a fair, like a concert, like a sporting event, then you absolutely should be masking during that event. If you are indoors and you are not fully vaccinated, then you absolutely should be wearing your mask and you should be socially distancing as you have been for the entirety of the pandemic. And those are the major changes. I should also mention one other change, which is that if you are fully vaccinated, again, if you're fully vaccinated and you are visiting persons within one family group who are unvaccinated, the recommendation is that you do not have to wear your mask for that. But if you're in a setting where you're visiting multiple people from multiple families, it's still to mask in that indoor situation. There are other changes. Those are the ones I wanted to highlight. But if you would like to see the full exhaustive list of changes, then you can visit cdph.ca.gov, which is the public health department's website for the state for the list of all of the changes. So moving on, I wanted to talk about the vaccine rollout. So as Sarah has mentioned, demand has slowed a little bit with the vaccine rollout, in particular in the 65 plus age group and somewhat for the 18 to 49 age group. So first, the 65 plus population, which is 59% vaccinated, really that number hasn't moved that much. And as Sarah mentioned, at least 41% of those in the highest vulnerability for a death and for morbidity, meaning symptoms and significant long-term damage, possibly if you contract COVID, those most vulnerable are still significantly under-vaccinated. So our work needs to be within this group, and so the efforts at this point will be targeted towards this group still. And if you are in this group and you wish to get vaccinated, there are many opportunities to do so. You can go to My Turn, which is the state scheduling website, and schedule your dose. And then there are also locations that you can look for within the county that will be providing walk-in service without without an appointment. Again, I wanted to mention the 18 to 49 age group because that is the largest population within the county when we look at these age group demographics, and therefore it's the most important that that group, considering these are the largest age group walking around in the county and interacting, that this age group be vaccinated, and we are still only at 31% vaccinated for this group. This number is increasing. Part of that reason is because of the rollout of the vaccination. So that's been pretty much the least amount of time that the vaccine has been available to this age group. But still, this age group is lagging behind state averages. And so we want to target this age group as well for further protection and vaccination. And especially because in family units, this is the age group that is moving around and visiting those who are a little bit more aged in the 65 plus population. And so to protect your family and to protect your loved ones and not carry this virus to them would be why we want this age group to become vaccinated and decrease the likelihood of transmission. I wanted to speak for a moment about the fact that we have all of the vaccines, as I mentioned before, the Moderna, the Pfizer, and the J&J vaccine, and we are very fortunate for this. There are many places in the world who are unfortunately experiencing a very, very high disease burden and disease rate from COVID-19 and attack rate, and we in Lake County are very fortunate that we have access to these vaccines, and you can get them if you want them, and you can get the protection. So that is why I'm harping on this, because we should not pass over the fact that we are very fortunate and that we live in a place where we have access to this. So please take advantage of it. I wanted to talk about our plans from the Department of Public Health at this point in the setting of some decreased vaccination demand. So the Department of Public Health has been having these large drive-through clinics in Lakeport and in Clear Lake, and we have been in the process of demobilizing these clinics as there are now many other locations to obtain vaccine, such as Safeway, such as pharmacies, such as the OptumServe sites, which are in Lakeport and also in Lower Lake, such as Walmart or your health system, Adventist or Sutter. So actually tomorrow, which is May 12th, that is the last day that these drive-through sites will be up and will be functioning, and they will be delivering second doses. And then after tomorrow, these sites will be going away. This is just the Department of Public Health drive-through sites. As far as people who were scheduled for the dates after this, they have been moved to the alternate OptumServe sites or other sites to obtain the vaccinations. So, with the Department of Public Health, I wanted to briefly talk about our next steps in the setting of talking about these different tiers, these different age groups, and the slowing vaccination demand. So with the demobilization of these larger drive-through vaccination sites, the Department of Public Health will be now focusing more on more targeted vaccination, meaning pop-up sites and mobile vaccination clinics in areas that we would like to help obtain access to have this vaccination. So as Sarah discussed, there are certain zip codes in the HPI-1 quartile that are lower in their rate of vaccination uptake, and therefore they will be targeted a bit more for vaccine access to provide this opportunity for vaccination to these areas of the county. We are also going to continue messaging about the importance of vaccination and plan on doing some targeted messaging to various different populations that have lower vaccination uptake. We also are planning to leverage our county partners to deliver vaccine at trusted locations with our trusted partnering groups to help to combat vaccine hesitancy and to help to discuss vaccine hesitancy with those who are hesitant, to help to deliver that vaccination to people who are somewhat on the line and not sure if they want to get vaccinated or not. So by discussing it with your doctor, and then also by having the vaccine available through trusted groups, this is our next step at targeted vaccine access to slowly and incrementally increase the vaccination coverage within our county. I also wanted to, for a moment, talk about children. As we discussed before, the 16+ population is now eligible for vaccination. However, soon in the future, I anticipate that the 12-year-old and higher or more aged population over 12 years old will be eligible for vaccination with the Pfizer vaccine. This is the communication that has been coming out of the FDA, and this is what I wholly anticipate. Therefore, I would anticipate that this is going to happen in the near future, and that these vaccines will be available, or at least the Department of Public Health is planning for these vaccinations to be available through your regular vaccine provider. So that would generally be your regular pediatrician or your regular clinician for your child who provides your other vaccines. Additionally, the vaccine will, like the Pfizer vaccine for children, will likely be available through select other vaccination sites, as I had mentioned previously, whether that be pharmacies or Safeway or OptumServe, and I would anticipate that moving forward. So, in conclusion, cases continue to be low, and I anticipate them to continue to be moving along in this very slight up and down movement, but basically at a low plateau. We are in the orange tier. We are still right on that yellow line, but with the vaccination coverage, we are still significantly far away from the state average. So if we can reach that within 5% of that state average and keep our numbers so low, there is a very slight possibility that we could move into the yellow tier prior to June 15th when all the tiers go away. But I think that that's a low likelihood, and so I would just plan on being with the orange tier restrictions and metrics until that goes away on the 15th of June. As far as vaccination coverage, as I mentioned, there is a slightly decreased demand, and so the targeting is going to be for the 65+ age group, which has stagnated a bit, as that is the most at-risk age group, and the 18 to 49-year-old age group. I wanted to reiterate one more time the new guidelines for those fully vaccinated, that you can be outside without a mask, and you can also be inside with others who are fully vaccinated, as long as everyone there is fully vaccinated, without a mask and without having to social distance. But you may do so if you want to. If you are in a location where you are in a crowded location, you have to wear your mask still. And if you are not vaccinated and you are outside and you cannot maintain social distance, you have to wear your mask. And if you are inside and you are unvaccinated, you have to wear your mask and still remain socially distanced. And then lastly, if you are if you are in a public location such as that is indoors, such as on public transit or in a business, then the recommendation is still that you wear your mask and that you socially distance if you're in any environment where there could be people who are vaccinated and unvaccinated. Where to get your vaccination? I think I've mentioned that a few times already. You can go to My Turn. You can schedule your vaccination. There are some locations doing walk-ins, such as Walmart and OptumServe sites. The OptumServe sites are in Lakeport and in Lower Lake. And so there are many, many sites to get your vaccination, so please do so. And please, if you are hesitant, if you are not sure, if you are waiting to see, please talk to your healthcare provider who you trust to discuss this, as there are many millions now of vaccinations that have been given, and this is a safe and effective way to combat this disease, and I highly recommend that you go to get your vaccine so that you can get protected and your family can become protected. Again, all the vaccines are available: Johnson & Johnson, Moderna, and Pfizer. All those 16 years of age and older are eligible, and soon it will be 12 years of age and older, as I have just discussed. And lastly, we are keeping our eyes on that goal of 70% coverage, which would give our county a significant protection against COVID-19 and its horrible effects. So with that, I'm going to end my presentation. Thank you very much for your patience and for listening, and I'm happy to take any questions.
Thank you very much for your presentation, Dr. Bloom, and thank you to Sarah as well. Jessica, Supervisor Pyska.
Thank you, Dr. Bloom, for that presentation. I have a couple questions. First, do we have an understanding on what the age groups are for the people that are testing positive these days?
I actually will ask that to Sarah if she's still on the line, as I don't have the specific breakdowns. I will say that when I last went over this with Sarah, I still thought that it was not one specific age group, but I will defer that because I don't want to give you an incorrect answer if Sarah is still here.
I do not see that she is still here with us on Zoom.
Okay. Supervisor Pyska, that is a good question, and I don't want to give you the wrong answer, so I'm going to defer that, and I will get that answer to you.
Oh, thank you so much. So she mentioned that she was adding in the IHHS patients or clients, and I was just wondering what percentage of those have been vaccinated, so that, you know, maybe that's a group that we could work a little harder to assist.
Mm-hmm. And with that, I actually don't have the data, and I'm sorry to say that again, I don't have the data in front of me for that. My understanding was many of those clients are vaccinated at this point, but again, I will get you that data specifically, as much as I have access to. I will get to you so that you can see the data, and that is a good point.
Thanks. So one of the things that I hear frequently is everybody I know has either had it or is vaccinated. So what is the guidance on for people that have already gone through COVID, and what's the recommendation there? I'm fairly sure that we still want them to get vaccinated, but I'd just like to hear that from you, what your thoughts are.
You are absolutely correct. Absolutely. So the guidance is if you have had COVID, that you still become vaccinated. If you have had COVID, then it is likely that you do have some protection. You probably do have some immune protection from that infection. That is how the body works. And that is how the vaccines work, is that they expose your body to a certain protein that is on the virus so that your body can recognize the virus when it comes into your body. It's a non-infectious protein from the virus that is what the vaccine is trying to show your body so that you can recognize the actual virus when it shows up. So if you've had the virus, then you do have most likely some coverage, some immunization, and protection from the virus. The problem is that there are a number of variants to the virus, and it's unknown exactly how much coverage and how much protection you actually have by being infected by COVID-19 if you've had it previously. And it's been shown that actually your protection is significantly increased if you do get the vaccine, even if you've had the infection previously. So while you still may have some protection from having had COVID-19, it's unknown exactly how long that protection lasts, and it's probably for a few months afterwards. Again, that's not an official recommendation from myself, but just based on how immunization works and what we've been seeing, it's probably some level of protection that's greater than zero for a few months after you've had COVID-19. But moving on beyond that, the protection is likely less than you would get from the vaccine, and it is for a shorter period of time than you would get from the vaccine. And then there's questions about the variants, which with the vaccine, the protection that you get from the vaccine has been shown that it's active against a number of different variants, but we don't have any data or really any very good knowledge about, what you would get, what kind of protection you would get from if you were actually infected with the virus, as it's really difficult to do any sort of scientific study on that. So that being said, that is why, a little bit further explanation why it's recommended that you get the vaccination even if you've had a COVID infection previously. You can think of it somewhat as almost, although it's not this in actuality, but it's somewhat similar to obtaining a booster shot. You've had some sort of immunization from actually having the virus, but having the vaccination will increase that protection significantly and should protect you over a longer period of time.
Would it be helpful to do some targeting messaging on that topic?
Certainly, that has not been a focus, but that's a good idea, and I think that would not be a bad thing to do. So yes, thank you for the suggestion. We can absolutely do that. It's been more focused on please get the vaccine, but at this point, yes, that can absolutely be put out as well.
Great, and I'm really glad to hear that we're going to start with the pop-up and mobile sites, because I think that's really going to help access the people that are having a difficult time getting in. So I appreciate you answering all my questions. Thank you.
Oh, sure, it's my pleasure.
Any other comments or questions from supervisors? Okay, I do have just a quick soapbox issue. No matter how hard we try to reach the criteria that we're told we need to reach in order to get to a different level of restriction, it seems we get hit with another criteria that prohibits us from moving forward. And I have to share my frustration that if you look at the list of vaccination rates on a per county basis, those who are of affluence are at the higher levels of vaccination rates, and those of poverty are on the lower levels of vaccination rates. And that should not be a burden on our businesses. That is an equity issue that the state tried to work on, but failed to meet. and that should not be a restriction that we're placed on. We're doing our best. We've been underneath the 2% before. Today we're not. We've been kind of going below and above that line. But everything shows that our hospital rates are great, our deaths are great. We haven't seen those types of burdens like we saw back in December, January, and yet now we're being burdened with, sorry, but you don't have enough people that are getting vaccinated. And when you say you have to be within 5% of the state average, and there's such disparity with the highest levels of vaccinations versus the lowest levels of vaccinations, I just have issues with that. And so I just wanted to express that. I have been expressing that through my CSAC contacts with the state. We have to be able to make us feel like we're progressing and not constantly being shown new barriers because they decided to change the rules on us. And that's why I can't wait for June 15th for that tier system to just disappear, because it seems it's been a bit of a mess ever since we started with that tier system. I did ask that same question. I didn't directly ask through the public health, but I'm also interested in, even if it doesn't show us anything that we can utilize data-wise, I think it'd be interesting to see who's still getting COVID-19. Does it show, does it help us in showing that vaccination works based on the percentage of vaccination on those age groups and looking at those age groups now and who's getting COVID-19? I just think it would be useful data to at least review and look at and hopefully maybe even utilize in our mission to get people to accept and say yes to taking the vaccine. And so hopefully that's data that we can get maybe within the next couple of weeks, and we can go ahead and dive into that. Appreciate your presentation, and if there's no further comments or questions from the board, let's go ahead and open it up for public comment. I see no public comment here in the boardroom, and I see one hand up over in the Zoom room. And Madeline Tuttle, I just sent you an unmute message, I believe.
Okay, yes, this is actually Dr. Will Tuttle. I'm on my wife's iPad here. And yeah, thanks for the report. Okay, so now, as of April 26, there are over 33,800 people have died according to the Vaccine Adverse Effect Reporting System, which reports between 1% and 10% of deaths. This is more than in 20 years of the vaccine reporting system just in 4 months. Over 16,000 serious injuries. Again, only 1% to 10% at most are reported. So we're talking about a so-called vaccine with unprecedented levels of death and serious disease and complications and injuries. And we're being told and we're being deceived that this is safe and effective. According to the Supreme Court, when they actually gave the pharmaceutical industry blanket immunity back in 1990, they said, quote, that vaccines are inherently unsafe, end quote. So that's why they gave them blanket immunity, and they've since then made so much money that they've captured the mainstream media, they've completely captured CDC, they've completely captured the medical school people, so they're basically deceiving us, and these are crimes against humanity that are being rolled out, and people are being very seriously injured by this. We're going against the Nuremberg principles, which require that people who are in an experimental protocol, that they be fully informed. And people are not being positively fully informed. People are being lied to that these are safe and effective. That's why they're getting vaccinated. These are not vaccines. These have never been approved by the FDA. They've only been authorized for emergency use. And so under this emergency use, people are being lied to. Anyone who tries to question the efficacy or the safety of these vaccines is censored. And so this is a terrible situation where when similar things happened in Germany or in other places, and people ended up going to jail for this kind of behavior that you're engaging in, you should be going to jail according to the Nuremberg principles of deceiving people and not allowing a full, accurate accounting of what's actually happening to people because of this. And also the test, the PCR test, is being monkeyed with now. The CDC, this is amazing. I mean, the CDC has allowed the amplification rate to be around 35 to 40 amplifications. So that's going to guarantee to give lots of false positives to make it look like we have a terrible pandemic. And now what they've just done is said that anyone who is vaccinated, you should only use 26 amplifications, which is going to show nobody gets sick. Nobody's test is positive if you're vaccinated. So this whole thing is based on deception and lies, just like the way these pharmaceutical industries. You have Pfizer, which is the most criminal company in the history of the United States, with multiple charges of racketeering and deception and lying to people. Horrible. All of these are criminal organizations, and you're basically just aiding and abetting criminal organizations and hurting people and not giving the other side. And I think it's incredibly irresponsible that you have to do due diligence and actually look at what the data says. The #1 epidemiologist in the United States, John Ioannidis of Stanford University, has said—
Dr. Tuttle, it's been 3 minutes. Please go ahead and finish.
Finish up. Has the same death rate or mortality as the flu. So we're doing all of this, and masking has been shown to be completely ineffective. It's harming people. So I really want to say you've got to look at the other side. Thank you very much.
I have a quick question for you, Dr. Tuttle, and I mean no disrespect at all, but what is your doctorate in?
I have a PhD from UC Berkeley in education, and I took courses in public health, in qualitative and quantitative research methodologies, and I understand science, and we don't have science today. What we have today is—
I don't need a longer answer than that. You've already answered it. I just wanted to let the public know that you are not a medical doctor and you are providing an opinion based on your knowledge and your understanding. I just want to make sure that when somebody says doctor in a conversation about a virus, that people understand who is speaking and from what level of expertise they are speaking from.
Right, but there's many doctors who agree with what I'm saying, MDs.
Okay, thank you very much. And just real quick, Dr. Bloom, if you wanted to respond to any of that at all, or not.
I just want to respond by saying that I appreciate the points of view. I appreciate the concern. There are many points of view which are based on rumors, which are based on different areas of science in our day and age now with Twitter and with social media, and then also based on personal belief and cultural belief. That's why public health is difficult. So what Dr. Tuttle was saying regarding a number of these different areas is that there are problems with masking. He has problems with masking and problems with vaccination, and a number of tried and true and proven and safe public health measures to battle infectious disease. And we're talking about public health measures in general. So I appreciate his personal points of view, and this is part of the conversation that we want to have with people regarding hesitancy, because there is a lot of disinformation out there, and then there is science, and science is what we are basing our approach to keep our residents safe on. Science is always what is leading our charge and what is driving the way that we are approaching this pandemic. We are listening to the experts. We are constantly engaged with the federal government and with the State Department of Public Health, who has always been here and exists to protect the population and to protect you. And it is based on science and based on studies through a scientific process. And so that is why we are doing what we are doing. And this is what public health is. This is why we do what we do, to try to protect you and to help you and to engage with you with your concerns. We are not an organization here to tell you what to do. We are here to partner with you and to help you lead a good life and to stay healthy. That is why I'm here. That is what we do. And that is all that I would like to say about that. And I appreciate all of the comments.
Thank you very much, Dr. Bloom. We have another hand up, Jessica S. And, oops, I'm so sorry. I may have just muted you. No, there you are.
I think I got it. All right. Hi, my name's Jessica Snell. I am a new resident in Lake County, and I just kind of wanted to get involved with the city council a little bit and share my thoughts and opinions on the vaccine and masking and everything. And as much as, you know, we all have our separate opinions and things that we believe, like I really believe that we all just want to see, you know, the common good and for everyone to be healthy and well. And I respect everyone's opinions. And, you know, as much as I want to believe science, I mostly hear what's going on is statistics rather than the science behind it. And, you know, I've been a pro-masker, pro-vaccinator for my whole life up until last year because, you know, what has been happening in our country has been very apparent. And as Will was talking about, the big pharma and the pharmaceutical companies that place these orders in line for people as a positive thing, but we've seen, you know, the epidemic of pain pills and the deaths and addiction rates of those, and to say that we should fully put 100% trust into the guidelines being set in place is, you know, I believe that everyone should have their own right and their own choice, and that a lot of this is a means of separation and status. You know, as someone else was saying, you know, the poverty rates and those vaccination rates are very, very low. Meanwhile, the higher percentage are very privileged to have the opportunity to be vaccinated or not. And when it all boils down to it, it really is a personal choice. And I think what most people who may not want to get the vaccine are trying to get across is that we kind of don't want to be alienated to not enjoying our lives and having that freedom to go outside and be unmasked and you know, have to show a card to get into a music festival or something like that. It just seems like we're going back in time to those days of mass separation and anxieties and you know, I don't want it to boil down to losing friends or family over these things, but I've had experience with these vaccinations. I've witnessed it firsthand, it making people very, very ill. And, you know, as much as I want to believe the statistics and science behind it, I have to go with my gut feeling and what I've seen with my own two eyes in this world, in this country, and what's been happening the past year and a half. And just the things that I've experienced alone has just, it's kind of opened my eyes. You know, at first I was really preaching to everyone wear their masks and sanitize and you know, stay safe out there. But after living in Los Angeles for a year and not getting COVID even once, and, you know, staying very safe, of course, but I've learned a lot over the past year and a half on how things are run and who is running the country. And as much as like I said, I want to believe in the statistics and the science and the news behind it all, like I really have to go with my gut feeling. And I just want to see less separation and more empathy towards everyone and everyone just being healthy, you know, generally. And hopefully we can all come to a common ground to find a way that we can all feel comfortable and free and willing to work together to kind of just make a common end to all of this, really. So that's really all I have to say. I don't know. I'm not a doctor. I don't have any status suture for that, but I am well educated and I have done my research for many years, and I rest assured in that. So thank you, and thank you guys for being here and sharing your thoughts as well.
All right, thank you very much. And there is no further comments. There is a repeat, but we're behind schedule, so we're going to go ahead and continue moving forward. Any further comments from the board? Supervisor Pyska?
So I do appreciate the dialogue and the comments today, and you know, it's important for us to recognize we are in this good place because of science and because of all the work that's happened over the year. And it is a choice to have a vaccine, and we're not, no one is forced to do that. It's your choice in this country. But as Dr. Bloom mentioned, there are other places around the world where people are suffering, and they don't have that choice and that privilege right now. And I think it's just an important time for us to recognize that.
Thank you for the comment. Any further comments before we go ahead and close this item? All right, Dr. Bloom, thank you very much to you and your staff. And tomorrow being the last day, I do want to appreciate the fact that your clinics that have been set up over the course of the last few months have been outstanding and have been absolutely helpful in getting our populations vaccinated and helping to decrease the burden of this unfortunate pandemic that still continues. So thank you so much to your staff and your team, and hoping that rest is coming soon.
Thank you very much. The team has been absolutely tireless and fantastic, and I wanted to express my thanks as well, and I do appreciate that. Thank you.
All right. Let's go ahead and move on to item 6.3, 9:30 a.m. item, presentation of proclamation designated the week of May 9th through 15th, 2021 as Law Enforcement Officers Week. And this is sponsored by the sheriff, and if the sheriff doesn't mind, I've passed it on to Supervisor Pyska to read. But I'm sure that he will have comments.
The Board of Supervisors, County of Lake, State of California proclamation designating the week of May 9th through the 15th, 2021 as Law Enforcement Officers Week. Whereas from the beginning of this nation, law enforcement officers have played an important role in safeguarding the rights and freedoms which are guaranteed by the Constitution and in protecting the lives and property of our citizens and the operation of correctional and detention facilities housing millions of prisoners and detainees throughout the nation, and whereas through constant application of new procedures and techniques, such officers are becoming more efficient in their enforcement of our laws and ensuring safety, containment, and control of human beings charged to their care, while sustaining uncompromised regard for their dignity and constitutional rights. And whereas it is important that all citizens know and understand the duties and responsibilities of their law enforcement agencies and the necessity for cooperating with them in maintaining law and order. And whereas it is important that all citizens know and understand the extraordinary risks and sacrifices the dedicated men and women who have chosen law enforcement as a career face as they safeguard our freedom and security and the public from the criminals in their custody, while at the same time encouraging such prisoners to develop skills and attitudes that can help them become productive members of a society after their release. And whereas it is fitting and proper that we express our gratitude for the dedicated service and courageous deeds of law enforcement officers and for the contributions they have made to the security and well-being of all of our people. Now, therefore, be it proclaimed by the Board of Supervisors of the County of Lake formally designates the week of May 9th through 15th, 2021 as Law Enforcement Officers Week in Lake County and publicly salutes the service of law enforcement officers in our community and in communities across the nation. Passed and adopted this 11th day of May, 2021.
Thank you.
So, and I just like to add that your entire law enforcement staff and everybody that works in the jail has gone above and beyond this year during the pandemic and everything needed to keep themselves safe, our community safe, everybody in the jail safe, and I'm just really, really grateful. And I learned earlier from Sheriff Martin that Correctional Officers Week was last week, but in Lake County, they're considered law enforcement. So I wanted to also give a shout out for the correctional officers.
Definitely, thank you. Sam put a wireless microphone on me. That might have been a mistake. He's going to have to catch me now.
Make sure you take that off before you leave.
Yeah, no kidding. I woke up this morning to news that 2 officers have been shot in San Luis Obispo from San Luis Obispo Police Department. I started my civilian law enforcement career in the county of San Luis Obispo. One of them died, the other one was injured, and the suspect was killed in the shootout. So not a good way to start the day, and not a good start for Law Enforcement Appreciation Week here in the state. This job has been historically tough. In good times, when times were, historically, this has always been a challenging job. It's got long, grueling hours. Half the people, when you get called somewhere, don't want you there. People are not always appreciative when law enforcement shows up. And as of late, with the high-profile shootings that go on, with the calls for police reform, it's an even more challenging time. And I think it's going to continue to be so as years go on. Over the past 10 years, on average, 163 law enforcement officers die every year in the line of duty. That's from car accidents, from shooting deaths, from on-the-job injuries. There's a whole variety of reasons. And on average, there's over 50,000 assaults every year on law enforcement officers in this country. Despite these numbers, there's still a demand for this job. People still flock to this. For a lot of people, it's a calling, and it's a way for people to serve their community. In Lake County, we don't experience a lot of those negative issues with our law enforcement, and a lot of how that has to do with we are the community that we serve. Our deputies work here. For the most part, most of them live in Lake County. They raise their families here. They have children here. They see people that they take enforcement action against. They see people that they help on a daily basis, whether it's in the grocery store, at children's sporting events, at school, and I think that really fosters a sense of community. People may not like what we do, but we strive to treat them with dignity and respect. And even if they don't like what they're doing, in a lot of cases they still respect us because we've treated them respectfully. We call this home. So this goes out whether you're wearing tan and green, blue, whether you're a police officer, a game warden, a highway patrolman, probation officer, deputy sheriff. As Supervisor Peiska said, a couple years ago we reclassified our correctional officers to deputy sheriff corrections, and we intentionally include them in Law Enforcement Week. We don't want them to feel like they're separate. They're peace officers, just like the patrol deputies on the street, and their commitment and their service is every bit as important and every bit the same as the patrol deputy. So we do that intentionally. We don't. It's not something. It wasn't an oversight. We want to make sure that as one agency, we're the sheriff's office. We're not the jail and the sheriff's office. We're not separate. We're together. And it was an intentional gesture to do that. With that, I want to thank the Board of Supervisors and thank this community. They treat our law enforcement well, and in exchange, our law enforcement likes to treat this community well. Thank you.
Thank you very much. Any further comment from the board before we move on to our next presentation? All right. Thank you for reading that, Supervisor, and thank you, Sheriff, for bringing that to our attention. Next one is 6.4, our 9:35 a.m. item. Presentation of proclamation designating the period of May 1st through June 14th, 2021 as National Military Appreciation Month in Lake County. And while I did sponsor this item and we're trying to make sure it's the correct one this time, I still would like Supervisor Crandall, as he is a veteran, to read that for us. And if you would like to come up, since this is absolutely because of you. So thank you for bringing this to us.
In fact, last week she reminded me that this is what we were going to be reading, but we'll be doing it now. And so this proclamation is designating the month of May 2021 as Military Appreciation Month. Whereas the freedom and security that citizens of the United States enjoy today are the direct results of the sacrifice and continued vigilance by the United States Armed Forces Services over the history of our great nation. And whereas Members of the United States Armed Forces and the family members who support them have preserved the liberties that enrich this nation, making it unique in the world community. And whereas in 2004, the United States Congress passed a resolution proclaiming May as National Military Appreciation Month, calling all Americans to remember those who have given their lives in defense of freedom and to honor the men and women of our armed services who have served and continue to serve our country. And whereas the months of May and June were selected for the display of patriotism because during these months we celebrate victory in Europe, D-Day, Military Spouse Day, Loyalty Day, Armed Forces Day and Week, which is this week as well. National Day of Prayer, Memorial Day, Navy Day, Army Day, and Flag Day, which are on the same day, and that's the last day of this proclamation, June 14th. Now therefore be it proclaimed that the Lake County Board of Supervisors does hereby designate the month of May 2021 as Military Appreciation Month in Lake County and calls upon all residents to show their gratitude and appreciation for our military personnel by the appropriate display of flags and ribbons. Passed and adopted this 11th day of May 2021.
As a retired peace officer, I want to thank the county for recognizing peace officer and law enforcement for the hard job they do. And also thank you, Brian, not just for your work in law enforcement, but for your service. I know you're a veteran. Thank you for your service. And EJ, thank you. And to your husband as well. I believe he's a veteran, correct?
Actually, he's non-military, but I have a son that's in the military.
Okay, well, thank you to your son. And thank you for this. I do appreciate the proclamation for Operation Tango Mike. Don't think I don't, because I do, and our volunteers are appreciative. It was shared on social media, and a lot of thank you for the recognition from our volunteers. And thank you for this. I will have copies made, and one will go in every care package this month. I anticipate care packages going to 12 countries. That's always in flux up to the night of packing, and at least 3 ships. So this appreciation will be shared across the world, and it's nice for people to see that Lake County appreciates our military. So thank you.
Thank you so much.
It's fitting as well as the weeks correlate because when we do the packages, a lot of the sheriff's deputies and law enforcement are there helping with those packages. Most of them have served or understand service, so it's just wanted to mention that.
Thank you for that.
You know, I would just like to remind the community that we're still trying to update our wall of honor that we have here at the courthouse. So if you have an active military family member, please send a 5x7 picture to me here at the courthouse, Supervisor Tina Scott, with their rank and what military they're in and what date they went in, and we'll make sure that their picture gets put up in the wall of honor so everybody in the community can see them.
Thank you.
Yeah, just one simple request. Since the proclamation is going to go in the care packages that are going over there, is there an opportunity for all 5 of us to sign on that letter? The proclamation, I put that out there as just a request.
I think we should ask staff to create that so that we can get that signed if possible before the end of the day, so that we make sure that we can get it to Jenny Craven so that she can put it in her care packages. Okay, that's a good idea. Appreciate that.
And do we know how many active military we actually have here in Lake County that are?
DOD won't release that information.
How many care packages are you going to be sending out?
I anticipate probably 75, but again, that's in flux as units deploy and units come home. Sometimes right up to the night of packing. It's not uncommon to have a family member walk in and hand me an address and say, can you add my son or my cousin? And we, of course, we do that. Probably 75, and March, our 18th anniversary, we've done 23,000 care packages, which is a real testament to this community.
And for those who were not able to hear, because Ms. Craven is not on the microphone, she was stating maybe about 70 to 75 packages this month would be going out, and that she has done over 23,000 care packages during her time at Tango Mike, and really appreciate the what was it, the paying it forward that I said you lead by example with the idea of helping those sometimes that you've never met. And that is something we should all be looking up to. So thank you so much for leading by example. And please anticipate an updated letter with all of our signatures on that. I believe from looking at Susan over here that she's working on that. Thank you so much, and great idea. Any further comments before we move on? All right. Let's go ahead and move on to item 6.5, our 9:40 a.m. item, consideration of presentation from Lake County Behavioral Health Services staff on National Prevention Week, May 9th through 15th, 2021, activities as well as highlight the work done year-round to support prevention of behavioral health challenges and needs in our community. Director Metcalf. Good
yes,
morning.
thank you, Mr. Chair. I'm actually going to turn this over to our Mental Health Services Act team leader, Carrie Manning, who's much better versed in this than I am. So Carrie, I see you're on. Take it away.
So good morning. I'm going to share my screen so that I can show you the amazing presentation that me and my staff worked on. Just let me find the right one. Oh, I think I got them backwards.
This is what I brought you.
Let me try that again. Sorry.
No worries at all.
Okay, there we go. Got it right. Good morning, everybody. My name is Carrie Manning, and I am the MHSA team lead for Lake County Behavioral Health Services Department. I supervise the 4 peer support centers and our prevention team. Today's presentation is in celebration of National Prevention Week, which is May 9th through the 15th. And let's see, it is a public education platform that promotes prevention year-round through providing ideas, capacity building, tools, and resources to help individuals and communities make substance use prevention happen every day. National Prevention Week culminates in May, recognizing the important work that has been done in communities throughout the year to inspire action and prevent substance use and mental health disorders. And prevention is defined as the action of stopping something from happening or arising. And our vision statement is to improve the quality of life for the people of Lake County experiencing mental health illness or substance use disorders by offering recovery-oriented services. And I'd like to recognize a team that assists our department in improving the quality of life for our communities. We have our prevention specialists, Kendra Boyce and Michael Moss. They have provided both substance use prevention and mental health awareness, suicide prevention services to the entire county. And our peer support center teams are David Abels, Edgar Ontiveros, Ana Tena, Jorge Morales, Melissa Farrell, Tony DeLange, Thomas Brown, and Patricia Santa Cruz. And we have a new staff starting, Elizabeth Arnold, next week. They are always willing to help their fellow community members during COVID. They have assisted with Project Room Key and the vaccination clinics, and they have also assisted in the pit count, the point in time count, and their determination and desire to have a positive impact on the community is very appreciated by everyone at LCBHS, at Lake County Behavioral Health Services. And this, based on Robert Wood Johnson health rankings, Lake County ranks 58th out of 58 counties in the state of California. For just our department to start to create change in our community would almost be impossible if we tried to do it alone. And so these are just a few of the wonderful community agencies that we have partnered with, and some of the community events that we participate in. And I know I haven't gotten everybody on here. This is just a screenshot of what we do. And we're lucky to not be in this alone. because by pooling our resources together and sharing ideas and data, we can effectively provide the services to more of our community. And so our youth substance abuse prevention program mainly involves education in the schoolroom. For the middle schools, we use Project Alert. It is an evidence-based program. And, you know, it helps our youth to understand the consequences of using drugs, develop reasons not to, understand the benefits of being drug-free, and also recognizing that most people don't use drugs. And we also, you know, help to increase their self-esteem, which, you know, limits the use. And then for the high schools, we use the Truth About Drugs. It is also an evidence-based program. And they do the same things. There's 14 truths about drugs. They go over the most commonly used. And again, you know, they educate on the effects. They educate on how to say no. And also, again, that most people are not using, which is, you know, a myth that a lot of our youth believe is that, well, everybody's doing it, when in all actuality, they are not. We also have the Partnership for Success state grant for opioid misuse and abuse prevention. And that has involved classroom education, parent education, school and community events. We collaborate with Lake County SafeRx. And then also we are going to be beginning implementation of the OD map, which will allow agencies to see where overdoses may be spiking in the community so that we can provide extra outreach and services to those communities. And then this year, our Partners in Opioid Prevention Summit will be on June 16th. And this year, we're really excited. We're going to have Tony Hoffman be the key presenter. And he will be sharing his experiences with opiates and how he overcame his addiction from opiates and homelessness to coaching in the Olympics. The summit is open to all of Lake and surrounding counties. And I really encourage everybody that can attend. There will be a registration link on our website and also on our Facebook groups and pages. And so in the prevention services, peer support workers are people who have been successful in their recovery process, who help others experiencing similar situations. Through shared understanding, respect, and mutual empowerment, peer support workers help people become and stay engaged in the recovery process and reduce the likelihood of relapse. And peer support services can effectively extend the reach of treatment beyond the clinical setting into the everyday environment of those seeking a successful, sustained recovery process. Our peer support centers are like the entry into many different services in the community. These are some of the groups and services that we offer. There's a survival cooking class where we actually teach people how to make meals with what they get from the food banks and different distributions. We have support groups in Spanish and English. We offer parent groups. We've had a youth-led peer support group, talking circles, life skills, art groups. Art really brings people together. Other things that they offer are advocating for people that are utilizing our services. They are a wealth of information on resources and how to link people to the services that they might need. And then, you know, they also offer self-help groups and other groups to help improve their lives. So The Big Oak Center is located in Clear Lake Oaks, and you'll see here some pictures. We do the shower trailer there and food giveaways. The primary focus of the center is severely mentally ill community members, as well as those that are unhoused. David Abels is the lead at the Big Oak Center, and he has worked hard collaborating with numerous agencies in the community. You know, he wants to make sure that every person that enters that building walks out with a smile and a need met. And he does a great job at that. There will be a Mental Health Matters Month event at the Big Oak Center on May 18th from 10 a.m. to noon. And that is also the day that we partner with Adventist Health for the pop-up care shower event. And the pop-up care and shower takes place on Tuesdays from 11 to 3. There are other agencies there that can help people apply for services that they might need with housing or health insurance. And we have the Circle of Native Minds, which is located in Lakeport. Oh, and I forgot to mention, I wanted to mention that we've served in 1920, I should say 2019 to 2020, we served 420 unique community members, and we provided over 27,000 services to those community members. And that could be, you know, referrals to different agencies, food, clothing, shower, whatever they needed. And considering that there's only, you know, there's limited staff at the centers, that's amazing. And also that we had COVID. That was a factor in providing services during that time period. So the Circle of Native Minds is located in Lakeport. Thomas Brown is the lead staff, and he provides outreach services to the Native American community by visiting the reservations, sharing the history of the Pomo culture to promote healing. Patricia Santa Cruz is also working there, and the center provides a variety of groups and support services, and it is open to everyone in the community. And, you know, Thomas does provide different cultural activities as well at the center and outside of the center. And there will be an event to celebrate Mental Health Matters Month on May 14th from 10 a.m. to noon. And all of these dates and times are on our Facebook groups and I believe our website. And then we have the family support set, and Thomas served 189 unique community members and provided over 7,800 services to the community. Family Support Center is located in Middletown. Their main goal is to help parents that could be struggling with their children, grandparents raising children, aunts, uncles, anybody raising, you know, kids, and helping them, guide them through the system, as well as improving their mental wellness. And it's, so in February of 2020 is when we opened, and then March of 2020 is when we shut down. So they've had some struggles. I'd like to encourage all the community to contact Melissa. If you're interested in the Parent Cafe or any of the other groups that we are doing, they also have a learning hub there. And we are working with Lake Helping Hand to provide a food distribution site, as well as Adventist Health to provide the shower trailer pop-up care event. And they will be having several activities over the month. The main one being on May 21st from 12 to 3 will be the main Mental Health Matters event. But check out their Facebook group. They have some great activities planned each week. Then we have Lavos, and Melissa and that center served 63 unique community members and provided 133 services. And Lavos is our Spanish-speaking Latinx community center, also open to everyone in the community. They do have the food giveaway there monthly, as well as they are working with Lake Adventist Health to provide a shower trailer pop-up care there as well. And we recently moved the center. It is at 14092 Lakeshore Drive in Clear Lake. They also do some art groups, Latina support groups. They have Spanish AA meetings there, I think 3 to 4 days a week. And Edgar and his team, you know, work very hard at providing services for the Spanish-speaking population as well as other people in the community. And they provided services to 648 individuals and provided them with over 46,000 services. The Harbor on Main is our Transitional Age Youth Center. We contract with Redwood Community Services so that we can provide youth with a safe place to go. They can do homework there, get help with that. They have free resources, clothing, hygiene products, computer, life skill groups. I know that they've helped kids find jobs. It's an amazing center. I went in there the other day. They've got pool tables and it's just a very friendly environment. And they served 174 unique community members and provided over 13,000 services and 1,200 visits. I encourage everybody to check out all of the Facebook groups and to see what they're doing at their centers. So then we also have our suicide prevention and awareness education programs. I'm almost done. Mental health and well-being are fundamental to our collective and individual ability as humans to think, emote, interact with each other, and earn a living and enjoy life. That is from the World Health Organization. And the Suicide Prevention and Awareness Coalition, we are currently working with Each Mind Matters on implementing the Striving for Zero campaign, which is a suicide prevention program to reduce completed suicides and provide education to the community. Part of this campaign will be to reestablish the Life is Sacred Alliance Suicide Prevention Awareness Coalition. All community members are invited to participate. Please contact myself, Kendra Boyce, or Michael Moss, whose our contact information will be coming up for more information. Lake County is ranked the highest per capita in completed suicides. And, you know, our goal is to reduce that and, you know, strive for zero. And we have some really good programs that work towards that goal. First, we have our mental health first aid training for people who work with adults, with youth. And then we also have the exciting teen program, which we started to implement right before the shelter in place happened and are currently, you know, working on bringing that back to the schools. That is a program that teaches youth how to support each other. And the main goal is teaching them that it is okay to not be okay and how to seek help for themselves or their friends. And then we also offer the adult and the youth mental health first aid that teaches us the same, you know, how to talk to others about suicide and that, you know, it's not the S word. And how important it is to be able to ask someone those important questions, how to respond to them, and how to get them some help. And then we also have 2 shorter courses that are Know the Signs and Question, Persuade, and Refer. These are both great trainings, just kind of like an entry level, you know, how to talk to someone. What are the warning signs? What do you do if you know, see the warning signs? How do you approach that person? So please look on our Lake County Behavioral Health Services website or the Lake County Prevention Facebook page for links to all of these trainings. If you or an organization would want a training for a group of people, please contact one of us and we will get that set up. And during the 2019 to 2020, we had 154 people that were trained in one of those programs. And we would like to see that increase even more. And 91 of those were school-age children or youth between the ages of 16 to 25. We do offer the QPR training and know the signs to our youth, as well as the teen mental health first aid program. And in conclusion, this is our contact information. And then, you know, just some quick, if you are experiencing some mental health challenges or just need somebody to talk to, you can call any one of these numbers. There's also a text line, 741-741, just text help, and someone will contact you back. So I tested that number out because I was like, oh my gosh, texting, and they do respond very quickly. So with that, I am going to stop sharing my screen. And I'm done, and I'm open for any questions.
Thank you very much for your presentation. I just want to make sure and reopen it up for Director Metcalf in case he has anything to add before we go to the supervisors.
No, actually, that's a tough act to follow. I know that was a lot of information. We tried to keep it under 15 minutes, but just wanting to share, because this is Mental Health Awareness Month and this is Prevention Week, we thought it would be timely to share, you know, some of the programs and services that we offer. You know, when I took over this position a little over 4 years ago, I didn't realize that we did so much. And so I thought it was time to have staff share what we're doing at our peer support centers and all of the other things we're doing around prevention on multiple fronts in our department. So I appreciate your time and thank you for, and thank you, Carrie, for the presentation.
Okay, thank you very much. Any comments or questions from the board? Supervisor Scott?
Just want to thank Carrie for her presentation and bringing this awareness to our community. Behavioral health does some amazing work, and so thank you for sharing all the programs that you have there. And also just to highlight the classes that you talked about, they're free to the community to sign up. So you never will know when you can use that information to help a family member or a community member. I've actually taken the class, and it was just good information to have. So I encourage everybody to sign up and take one of those classes.
Thank you very much for the comments. Any other comments? Supervisor Crandall?
Yes, thank you for the presentation, and just wanted to state that I appreciate seeing the different variations of services and support services for different ethnicities and whatnot, but we all do get addicted the same. We all respond the same to these, well, you know, if we're addicted, we respond to the substance the same, but we all end up in this very similar situations. We have family that's affected by these type of things. And it's very imperative that we ensure to prevent suicide and all of the other measures that you put forward. And so I just wanted to thank you again.
I did have a question, and I'm not sure if that would be Carrie or Todd that would be able to respond. Seeing the numbers of services and unique individuals that are helped by each facility, I see that Lavos has a very large unique member count and services. how far-reaching is Lavos? I know it's in Clear Lake, and obviously there's quite the population that surrounds it, but do they see community members from throughout the lake, or is there a need in the future to look at possibly duplicating that service somewhere else in Lake County? Because I know that there's very large pockets of Latinx community members in the Kelseyville area and other places as well. Just want to make sure that they have that level of access to this facility.
Thank you. I know that they are very busy, and I think it's because they have been here in Clear Lake since we started the peer support centers, and there is a need elsewhere in the county. Patricia Santa Cruz at the Circle of Native Minds is Spanish speaking. She is Latinx from that community. And so, we're trying to increase the reach by having bilingual staff at the different centers. And we are also in the midst of a very exciting project. Our outreach van is going to hit the streets hopefully within the next couple of months. We still have some work to do, and the staff that are going to be on the outreach van, our outreach is primarily going to be to the homeless community and youth that are unhoused. But we're there for the whole community, and staff from the different peer support centers and our prevention specialists will be on the van, and we'll be able to if needed, transport them to a medical appointment or the emergency room or to Lavos or one of the other centers. I feel like, while there is that great need throughout the whole community, I think that we are reaching, that the Hispanic, Spanish-speaking population by being able to connect with Lavos. And having Spanish speakers at the different sites.
Awesome. Thank you very much for that update. I think that obviously you know better than I do, behavioral health is becoming more and more an important conversation we're having, not just as a nation, but in the state as well. Even as we slowly see ourselves out of the pandemic right now, there's still many goals being set to enhance behavioral health services in our communities. The conversation that's happening nationally with law enforcement has a lot to do with behavioral health opportunities as well. By closing some of our facilities in the past, has put that burden on top of our law enforcement. How do we retackle that situation to bring a better balance in our communities? So I think that we're going to see a bigger summary in the upcoming years versus what you're proposing today and offering today. And so I look forward to what those changes are, because I know that the state is not done providing some funding to make those things happen in our community, and I look forward to implementing those.
Right, and I forgot to mention that we are working with the Sheriff's Department and the local police departments on providing the adult mental health first aid training to as many of their staff as we can.
Thank you for adding that. Supervisor Paiska?
I just want to applaud your innovation and going out and developing all these programs and the creating the opportunities for cultural access, and now with the mobility van. The mental health is really about the whole person care, and you're doing an excellent job, and I really applaud everybody in your department and all of the work that you're doing.
Thank you.
Yes, thank you.
Any further comment before I open up? Supervisor Simon.
Obviously, follow right along with the rest of the board, just the great work that's being done. But I do have one question, and what we've learned, obviously, and I know it's increased in this time, is Zoom appointments and other things. I know that sometimes the outreach, we have the phone numbers here and other things, but in the future, will there be an opportunity for folks to do Zoom intervention lines and other stuff like that. So I have that question going forward with what we've learned during this pandemic, that, it helps not only just to be talking, but sometimes seeing a face and seeing those emotions and understanding somebody. So I just wonder, it's great, everything we have here, but if that is something being considered by you guys.
Well, we have actually already, I think all of our peer support centers are doing some type of Facebook room group daily. I know at the Big Oak Peer Support Center, he has been doing coffee chat every morning at 9 o'clock. I think we have some issues with Facebook right now, but hopefully we're going to get those resolved so that we can start that again. And then we have the Parent Cafe. So we are utilizing, Zoom as well as Facebook rooms to be able to provide that virtual support. And then currently we are installing smart boards at each one of our centers so that we can provide even more virtual support, and we can move into a hybrid model, for those people who feel more comfortable watching on Zoom or participating in a Facebook group, or, just being able to have that one-on-one, at least face contact with somebody, if not in person. So, and I have to really applaud our staff because, a lot of our staff haven't been using computers, and so they've had to really learn how to integrate the virtual services in with the in-person style of providing services. And they've done an amazing job.
And just to add to that, we've been having conversations at the management level in our department with restrictions, COVID-19 restrictions being loosened up, that we're trying to address how we can get back to more in-person services. So we're absolutely having those conversations, because I feel like during the pandemic, although I've said that maybe some of our no-show rates went down because it was easier for folks to engage via telehealth, I'm sure we've been missing folks that weren't able to access, via internet or even cell phone. And so, yes, we're absolutely taking a cautious approach to getting back to more in-person services.
Yeah. Well, I guess my comment is always everything we've learned, just having every option, because everyone is different in how they're going to approach it. So going forward, that even as the things lifted or unrestricted, that we keep that other option out there, because that might be the one lifeline that gives someone an opportunity. So that's just my only comment.
Oh, absolutely. I mean, this has been a game changer. And if we can do both, as Carrie mentioned, with this hybrid model, I think we'll have even more success in reaching more folks.
Mm-hmm.
Thank you very much. If there's no further comment, let's go ahead and open it up to the public for any comments or questions. I see none here in the boardroom. If you're in the Zoom room, please press the button at the bottom of your screen to raise your hand, or dial *9 if you are in via telephone. And seeing none, we'll go ahead and bring it back. And thank you for your presentation today and updating us as well as the public on all the services that are available through behavioral health. And keep up the good work.
And thank you for the opportunity.
Yes, thank you. And we have more services than this, so stay tuned.
Yes.
Thank you.
Thank you.
So it is 10:57 a.m. Our next item is an hour behind. It was supposed to be at 10 a.m., but we are going to take a 10-minute break. And so we will come back at 11:07 and get started on our 10 a.m. item. Check, check. Hello, hello. All right, everyone, welcome back. It is 11:08 a.m. We are going to take on our 6.6 item, 10 a.m., discussion and consideration of board action in response to a gate on a public roadway. And with that, I will pause. Okay, so Supervisor Crandall will be recusing himself. Not sure if anyone heard. I wasn't sure if your microphone was on, but it's now known. So we'll call you when we're done.
All right.
Thank you. And I am going to open up this item with our county counsel. Ms. Grant, if you can please present this item.
Yes, thank you, Mr. Chair. Let me tell you, please, that I've provided you with a very brief memo. The memo gives you 2 citations to the Streets and Highways Code, as well as a brief recitation of the history. The item is before you as a simple agenda item. It is an agenda item whereby you may discuss and consider whether you wish to take further action in regard to the existence of a gate on Foothills Oak Drive in Upper Lake, California. Your board had previously taken action in 2015. I think it's important for everyone to understand what this particular item is not. This is not a public hearing. This is not an administrative hearing. This is, your board is not sitting in a quasi-judicial capacity in any way. You are not going to hear legal arguments and admit evidence. You're not creating an administrative record. This is a standard agenda item where you are considering one issue, whether you wish to engage in any further response to the existence of a gate on Foothills Oak Drive, which is a public road, though not maintained by the county. The consideration of this item then is to consider those further steps, if any, you wish to take. You are not making any determinations as to whether and to what extent you have any legally cognizable mandatory duties here. You are looking at the issue under the 2 statutes that I've provided as to whether you wish to take further action as to this gate on this particular road. I am aware that there are counsel who are going to be on the call, and I'm asking them very clearly that they respect those limitations, given that there is pending litigation on this matter, because it would be inappropriate to introduce that here, where again, your board is not sitting quasi-judicially. So again, people may be submitting things to you. That's not evidence submitted. It doesn't thereby create an administrative record. You get comments and additional documents all the time when there's an agenda item. This is no different. Had it been in any other capacity, it would have had to have been properly noticed and clearly and unequivocally designated as such. It is not, and that is purposeful. So with that, I can tell you that, again, your board had taken prior action. No further action has been taken for a number of years. Gates are not allowed on county highways except gates that are allowed by your board in connection with 966 of the Streets and Highways Code. I've cited that for you under those circumstances where you may allow for those things. The allowance of a gate on a county road is not a new process. It has been going on for some time. Your board can determine whether under what circumstances you wish to allow a gate, or if you don't wish to allow a gate at all. Your board need not take any action today. You can listen to public comment. Again, it is a simple agenda item. Your board may take action if you wish to, or you may simply discuss it. It's on as discussion and consideration, so the options remain open to you. Again, just not in a quasi-judicial capacity.
Okay, thank you very much for that presentation and introduction. All public comments will remain at a maximum of 3 minutes. So please be succinct when speaking, and I do want to ask the board if there are any questions or comments before we do open it up for the public. No. Okay, so I think we all want to hear what the public has to say, and I believe that we have Chairman Cromwell, and you have your hand up, so let's go ahead and begin with you. Welcome.
Hi, everyone. Thank you for this opportunity to speak to the Board of Supervisors. Grateful for that. I am Chairman Benai Kim Cromwell, representing Robinson Rancheria, located in Nice, between Nice and Upper Lake. And today I just wanted to talk about how this gate being closed has helped our area. It's not that throughway that allows notorious or devious activities to go through there, but we still are struggling with some things back there, whether people are dumping garbage on our land, having drug use because of that roadway. We have ATVs and motorcycles going over our fences and around our fences, which causes us in concern because they might actually have, here's a few photos of things that have been in our land. But we don't want a fire, and we don't want any we don't want any exhaust or any fumes or anything to be lit up there, because that, again, would be a liability on our tribe. So we want to protect our roads and our lands. And one of these, and this gate here and safety gate has been doing such that we do provide everyone with a key so that it is not closed forever, including our fire department and our sheriff department. So nobody's complained about this being up except for one community member. And this community member has access to Highway 20, unrestricted access to Highway 20 from his driveway. And this road and this gate is way beyond his, it's not next to his driveway. And so we feel like this gate being up is a safety concern for our community and all the landowners and the property owners around it. We've talked to them all. We want to give them an opportunity to find a way where we could work together to make sure that we're all on the same page for community safety. This road, with the gate open, is just a floodway to go from Pile Road all the way.
Up right now. Sorry, I'm on a board meeting. But
so just wanted to say that this has been a community issue. It has been closed. It has helped us somewhat mitigate the desecration of our land and the people that want to do nefarious activities on it. So we're just in favor of hoping that we can keep this gate locked, but we will provide a means to make sure that everyone has a way to open it, that has access to it. And so I just want to say thank you for this opportunity to speak.
Thank you very much. I see we have Brian Momsen.
Yes, good morning. Do you hear me?
Yes.
Thank you. Thank you for the opportunity to speak. I'm an attorney in Ukiah. I represent Gary Sabaloni, who's a neighbor to the north of the Robinson Rancheria facility. I won't get into how this isn't a judicial hearing or whether it is or not. In my brief time, I'll just make some factual points. First of all, this gate is over a public roadway, and the roadway was accepted for public dedication at the same time Mr. Sabaloni and his parents back in the 80s received an approved subdivision from the county. And the road approval as being public was part of that process. So even though Mr. Sabaloni is just his family there now, there could be as many as 10 houses that have already been approved as part of a subdivision on his property. And locking a gate over a public roadway, even if a key is provided, which he hasn't received one yet, would be a danger in the case of wildfire, which has been a big problem for this county. And I believe the county's even involved in a suit in Gwinnett subdivision over lack of emergency exits and so forth. So I also don't see how putting up a gate in the middle of a road prevents people from dumping anything, as we saw in those pictures. People can still drive to either side of this gate to do that. And lastly, a key is not a good solution for someone would still have to get out, maybe in bad weather or in a fire emergency, and unlock the gate. We don't think the gate should be there at all. It should be either removed or you should stick by the 2015 board's resolution that the gate must be kept open. But if it is going to remain, we would at least suggest that there be like a key code where someone doesn't have to exit their vehicle and just punches in a code, and that be controlled by the county, not the Robinson tribe. And I'm happy to answer any questions. We submitted a bunch of documents, and I don't necessarily mean to tie this to the lawsuit, but the suit did have a bunch of factual, Mr. Sabalone's version of the facts and a bunch of attachments. I also submitted an aerial photo and some correspondence, so I'd ask that at least be considered. And I'd be happy to answer any questions if you have any. Thank you.
Thank you very much. Next, we have Ms. Boland.
Morning. My name is Little Fawn Boland, and I'm here in my capacity as General Counsel representing the Robinson Rancheria. First, I just wanted to point out that Mr. Sabalone doesn't dispute the board's broad discretion under Section 966 to erect and maintain gates and to allow others to erect and maintain gates. The board can make a decision at any time in the best interest of the community to permit locked gates on public roadways, and there's nothing impermissible about the board granting the request from the tribe. Nor does Mr. Sabalone dispute that prior to acquiring this land, this gate was actually already there. It was put up by local neighbors, not the tribe. It's the tribe who recently repaired it and gave it a locking mechanism. They absolutely reached out to Mr. Sabalone and offered him a key. He refused to accept the key. So I would like to note there's been multiple letters, efforts to cooperate and work with Mr. Sabalone. It's also telling that not a single neighbor has objected to this locked mechanism, nor have safety personnel. The only person who has raised any concerns is Mr. Sabalone. His objections are frankly theoretical inconveniences. He has, I'm showing on the map here, he has the absolute capability to drive on Pomo Way to get to his parcel. It's the easiest parcel to travel through. He does not need to take the circuitous route to go all the way around, but he's actually inconvenienced himself to make a point. Likewise, he's mentioned that in all of his different communications that this is a safety issue. In fact, the only escape route he says he has is if he needs to have the gate removed to have a safe escape route. Again, the quickest and most immediate route to travel west or east for that matter from the Sabalone residence is via State Highway 20. In any type of emergency, the shortest, quickest, and most immediate way for Mr. Sabalone is to get to State Highway 20 through Pomo Way. Again, we're not limiting his access. He has unfettered access to his parcel. He's just choosing not to accept this gate. I wanted to reiterate that in weighing the harms between leaving the gate open during, let's say, daylight hours or leaving it open all the time compared to the tribe, it just simply weighs in the favor of the tribe. Again, as the Chairman Cromwell said, they have 400 to 500 acres of unmonitored land for people to trespass on. And this gate has had a measurable mitigation effect. It's impossible for them to monitor all of this land. They are very concerned about a fire in that area because of the people going up with ATVs, motorcycles, etc. And it's a true liability for the tribe. They are certainly willing to work with the county, but it's very important that whatever solution is selected or considered, that it's a workable solution. And we believe the locked gate would be a solution. Finally, I just wanted to point out that there are dance grounds of cultural significance in that area. People are driving over those grounds, desecrating the tribe's land, and it has major cultural significance. And there's also a lot of erosion going on in the area and garbage dumping. So with that, I will leave this with the board, but I'd just like to reiterate that the harms to Mr. Savoloni are at this point theoretical in nature. He has not actually sought to subdivide his parcel, and the harms to the tribe are very real and need to be mitigated. Thank you.
Thank you. And if we can close down the shared screen.
Yes.
That way I can see the rest of the room. Thank you so much. Any other public comment on this item? Please raise your hand if you have a comment. The icon is at the bottom of your screen to raise your hand, or if you phoned in, dial *9. And I see nobody in the room here. And looks like the only hand I see right now is Brian Momsen, and that will be a repeat. So just if I'm going to do one repeat, just to let everyone who's already spoken, you have that chance as well. I just want to make sure that everyone is heard. So Brian Momsen, let's go ahead and give you another chance to speak.
Thank you. I'll be quick. Just very briefly, as you can see from their aerial, which was better than the one I submitted, the gate's well up the road from Highway 20, so it's still accessible from Highway 20 from either side. So it's not preventing any member of the public from getting to the tribe's property or getting to a location on the road where they can dump garbage or do whatever they want. That's all I wanted to say. Thank you.
Thank you very much. Just doing one final call for public comment before we bring this back to the board, and I see that Ms. Boland has her hand up.
If we're allowed to repeat, I'd like to just make one other point.
Yes.
What the tribe is requesting is that the gate be locked at all times to help restrict vehicle traffic on Foothills Oak Drive between Upper Lake Lucerne Road and Pomo Way. The tribe accepts responsibility for maintaining the community safety gate and including the lock and keys. They're proposing that each landowner with property abutting Foothills Oak Drive between the terminal roads and as well as safety personnel shall have a key to the lock for the safety gate. That no person would be provided with a key for the gate. Any person who's provided a key would make a commitment that they would not make copies, and that the Board of Supervisors and the tribe shall maintain a written list of each person that the key is issued to. And so we're very much willing to work with the county. If the county wants to be in the driver's seat with regard to the keys or the locking mechanisms, monitoring that locking mechanism, the list with the keys, whatever's necessary to cooperate, we are willing to do that. But we just need a solution that does thwart the access of the public to this land. Thank you.
Thank you very much. And I see that Chairman Cromwell also has his hand up.
I just wanted to say thank you to the board for allowing me to speak today, and that we are willing to work for a workable solution for everyone that's in this area. So just wanted to say thank you for that. Appreciate it.
Thank you.
Mr. Chair, if you're done with the other public comments, you might want to see if Public Works Director Scott DeLeon has anything he'd like to add.
Okay, and I see
he's
that Director DeLeon is here with us. Do you have anything to add to this discussion since Public Works has everything to do with roads?
Well, I appreciate that. Thank you for asking me to join the discussion. I don't really have any additional information. As it was pointed out earlier, this road was dedicated for public use. However, it is not within the county maintained system. I would ask that, there's been some discussion about the county being involved in monitoring who uses the gate or having some some participation with the gate, and I would want a lot of additional detail on that before Public Works is going to commit to doing anything there. We don't have any maintenance responsibility on that road presently, and so I just I'm a little cautious about that, but I don't have any other additional comments. So thank you.
Thank you. Okay, so let's go ahead and close our public comment portion of this item and bring it back to the board for further discussion. Supervisor Pyska.
Yeah, I have a few questions. It sounds like we're getting kind of differing opinions. So does the gate block access to the tribal land?
And if it's possible for Ms. Boland or Chairman Cromwell to respond to that?
I would defer to Chairman Cromwell on that.
The gate that we are discussing does not, it's only blocking Foothill Oaks Drive. It is not blocking to get to Robinson Land.
And does the gate keep people from dumping out there?
If you're coming from Upper Lake Lucerne Road because you want to get to, land that you can hide and throw stuff away, that gate will stop you right there, right really close to Upper Lake Lucerne Road to stop you. If you want to come behind the casino to think that you can go up into the hills and to the mountains, we have another gate at Mountainside Road to stop. So there's 3 gates right there. People still go across our dance grounds to do what they want to do nefariously, but those are a really good stoppage for people who have ideas that they think there's access that go anywhere. But that does stop on Foothill Oaks Drive on both sides if people think they can do a drive-through, drop off and drive through, because you can't. You're going to have to turn back around, and we have cameras on our casino parking lot to make sure we could see anything like that.
So you can't drive around the gate? You can't access around the gate?
No, but they are driving around the gate. They are desecrating our fences as well as our dance grounds to go around it and go up hills. So we do see that constantly.
And then my other comment is just that if the land was developed into a subdivision, then there would be activity there would be people living there, construction, and I don't think that you would have the same issues.
Any further comments or questions? Supervisor Simon?
Do we have someone on? All right.
No, let's go ahead.
Yeah. I appreciate all the information. I know this has been an ongoing issue here, but my question would be, it sounds like we have somewhat of compromise, I think, that could be reached. So my question would be, is there any opportunity to, if we're going to consider leaving the gate, an opportunity to have it electrified? So whether it's solar or any electric out there, so that people would have clickers. So then you could have it locked, but no one would have to get out to open the gate or anything like that. I heard it talk about, well, I don't want to get out during hot weather or any other emergency opportunities. I know for access in that manner, see a lot of that done out here on the ranches and stuff, that they have solar gate opportunities where they can have a punch code or something like that. So, and ultimately that would be, I'm asking this time the chairman, if that would be something that the tribe would be willing to compromise on and give an opportunity. I know we were talking about keys and tracking those, but I myself see that as a challenge from the county accepting that. It would be more tribal responsibility and working with its surrounding neighbors, and I know we're here because we have one at least that doesn't, so I just wanted to ask that question.
Yeah, the tribe is willing definitely to any workable solution for all of our neighbors that are on Foothill Oaks Drive. It is, again, those who don't live there that we're trying to, to keep out. So there's no, that's what we're here for, to have that conversation. That conversation is not a problem from our side because we have maintained that gate. That lock has been broken many times. That gate has been bent, and we still fix it every time. So we're not asking, we'll maintain it. But if there's a compromise that way, we're willing to have a solution that works for everybody.
Maybe a clicker would be better than a keypad, which you could give out the code to anybody.
Yeah, that you know, that was my thought also, you know, instead of the keypad, because anybody can give that. But if you know which homes have the clicker and you have an opportunity, there are programs out there, I think, that you could see who was using what system and who used it. So I just put that out there as a compromise on both sides. Understand, obviously, we live here in Lake County, obviously ingress, egress is always very important. Want to make that as smooth as possible. In the midst of a firestorm, getting out and unlocking a gate is always a challenge. And then ultimately, for entrance of our first responders also, making sure that the, you know, if something's going on out there, that the sheriff and also the fire department have easy access, and I know they have those access boxes on most of the gates that are put up. I know, you know, we have at least one that we work with Caltrans that has that opportunity for easy entrance for our first responders. So I just put that out as a suggestion for the board to consider.
Thank you very much. Supervisor Scott?
I would definitely agree with a compromise. It's definitely necessary to keep that gate up. We see this all over our communities, areas that people dump in because they can get into easily and not be seen. So I think we need to be working with the tribe and the property owners to try to make sure we maintain that. If it, whatever direction we need to go, I think we need to do that. And I agree with Supervisor Paiska that if they did subdivide and there was a bunch of homes back there, we probably wouldn't have this issue. And maybe if, you know, down the road that happens, then maybe bring it back and we can, you know, revisit this option.
Ms. Grant, looks like you have something to say.
Just as you're beginning your discussion of what your board may or may not want to do today, let me tell you that you can certainly employ whatever means you like. You can also have triggers in your permission that say, should X event occur, that the matter does have to be revisited by your board to determine what's appropriate under those circumstances. Or by Department of Public Works first, and if there's a resolution is unable to be achieved, then to your board. But there are options that you can do today to decide, again, do you want the gate always locked, open during daylight? Do you want it closed and on weekends? All of these things are going to be up to you. I think that you're talking about first responders, which is critically important for law enforcement and fire personnel. And if you feel that a clicker mechanism is the most advantageous for everyone, and most critically, the only way you'll allow the gate to be maintained, then that's certainly up to you. Again, you determine the circumstances here. You stated you want to make sure you're fair to all parties. And so compromise is generally the way to achieve that.
So I will provide my opinion on this matter. So this is a public road, and I know it's a public road that's not maintained, which to me, in my mind, that's already part of the problem. By allowing ourselves to take in roads that we claim aren't going to be maintained, we're pretty much saying go ahead and do that type of activity there because we're not doing any activity on that road. And so that leaves a lot of bad potential for things to happen. I hope that in the future we'll start looking at making that change because I really think that will help us. On the other side, it's a public road and there's a gate, and that doesn't make sense to me that still qualifies as a public road because that seems more like a private road. And if it's not going to be our gate and it's someone else's gate, now it seems to even fall more on the side of it's a private road and not a public road. It just, I'm getting very confused as to who is looking to change our road and how is that still being seen as a public road. And we're seeing pictures that gate's not really doing the job that it's looking to do. There's still dumping going on. We saw pictures just today. So I would say we need to up our game a little bit and take on the responsibility because this is not a unique scenario. This is throughout our entire county. We have places like this where people are just desecrating our properties, our land, our beautiful scenery. And by putting a gate, obviously from the pictures, it doesn't prohibit those things from happening. I think we have to take a stronger approach. I know that there is some conversations, they're not done yet, happening in our waste management committee about upgrading our illegal dumping strategy and ordinances. And part of that is possibly setting up cameras and really catching people who are illegally dumping. There's some perfect plans that are shown to us from Alameda, from Butte County, that we can utilize in order to decrease that. We have a culture in our county that it is perfectly fine to go throw away whatever you want, anywhere you want, and that is something we have to attack in a very confronting way, not an indirect way, but in a very direct approach. And a gate is not a very direct approach. It's a hope that this will fix it, and it doesn't make sense when you can access that gate from one side of Foothill and access the other side of Foothill, and you would actually meet each other just on both sides of the gate, which means that it's not prohibiting anyone from going through, other than maybe you have to be seen by more people if you take a certain route when maybe you have a truck full of garbage. I want to stop the garbage dumping. And then if that stopped, maybe there wouldn't be a requirement to have a gate on this road. I don't feel comfortable with saying yes to a gate on a public road, or else, well, how is that a public road? If the public itself doesn't get to use that, doesn't have a clicker, doesn't have a code, whatever it is that we choose, it just seems to take away from the fact that it's a public road. So I'm more on the approach, we need to solve our county-wide problem where this is happening. This is not a Robinson Rancheria problem. This is not a Mr. Sabaloni problem. This is a Lake County problem where there's a lot of areas where it's out of sight, out of mind, and people seem to think it's perfectly fine to do these things, and we need to figure out how to stop that. And I don't want to see gates popping up everywhere where all of a sudden we're restricting access to our beautiful county in order to solve a problem that maybe we should be able to solve in a much more direct way. So that's my position on that. I'd love to hear how others feel about gates on a public road, and where do we stop if we say yes to this one, to are we going to have more gates on other areas? And Supervisor Paiska.
And that is one thing that I've been thinking about all weekend too, is what sort of precedent does this set for the rest of our county and for the rest of our rural roads? But we have a solution that is sort of working right now. There's one neighbor that doesn't like it, but what is the solution? If we're not going to allow this gate, then what do we do? And it's not something that we can put off and say eventually we're going to figure out. You know, I don't feel like we can say no to this gate without having another option to say yes to.
And this is why I was alluding to what the Solid Waste Management Task Force is discussing, because that would be a perfect place to start once that is finalized, which I'm hoping within the next month or so it will be finalized. And I agree, we need to have some sort of solution because there's a problem. It's whether or not the gate is to remain and help solve the problem, or if the problem will persist and the gate is just an additional thing that doesn't actually provide a solution to the original problem. I think, and my personal opinion is, at what point do we take responsibility for the public road? And if we are going to claim it's a public road, then we need to take that responsibility, not pass it on to Robinson Rancheria, not pass it on to someone else. That's where we need to look at changing that. Supervisor Simon.
I agree with Supervisor Paiska about, an opportunity now. I appreciate your lofty goals of we're going to stop people from dumping in Lake County, but those are pretty lofty goals. I'm not sure what ordinance you're going to put in place that stops dumping in Lake County. We've talked about this before, about passing ordinances and other things that are
unenforceable because we won't have a task force that's out there in the middle of the night. And let's just take, this is one road. As we all know, we have roads that are notorious all over the county. There's not going to be someone out there at 2 in the morning for an illegal dumping off the end of Dry Creek Road that is 4.5 miles back there. I mean, I appreciate your lofty goals, but it seems like what we're talking about today is this one gate instance. As I understand, and Anita can correct me if I'm wrong, if it was to come up, this really wouldn't be setting precedents. I think each and every time it would have to come to the board. If there is an opportunity, maybe I'm wrong on that, or if someone is challenging it, we would be looking at them individually. So the precedent setting would be, hey, let's get a compromise in a community that can help in a positive way in the conversation today. So I just want to clarify on that, on the gates. We make the decision. That was very clear in all the information we got today. This board or any board in the future would make that decision. It wouldn't just open any floodgates for this to happen.
Correct. We're not making a policy decision that everything else is going to be taken in the same way. This is on a specific subject, and each one would be taken individually. Ms. Grant, did you have something you wanted to add?
Thank you. Just again, I wanted to also point out that 966 of the Street and Highways Code does provide that the person for whose immediate benefit the gates are erected or maintained shall in all cases bear the expense of erection and maintenance. So that's written into the Streets and Highways Code. I think that's why you're hearing it today. It's not an abdication of your responsibility. It's just part of what state law requires. So that is why it's there. I can also say that you know, your decision with regard to this gate is your board takes these up and considers each circumstance, and each circumstance may be different. Normally, you look at any type of public road as not having, generally having an obstruction, but there are reasons why a gate can be erected on the road, and the Streets and Highways Code recognizes that very clearly. Sometimes a solution presents a partial solution. In other words, it may stop some illegal dumping. I doubt there's anything that's going to prevent all illegal dumping. Everywhere I go, there's someone who spends more time figuring out a way to sneak out and dump something than actually just taking it to the transfer station. So that's not a problem that you can solve today. However, in recognition of that as a goal for your board, you can limit the extent of your permission. And you can, again, as I said, you can address the issue of public access, requiring the gate be open during daylight hours if you wish to. You can determine to allow it to remain under certain circumstances and look at it again in a few months to see if your solution is addressing what you wanted it to. All of these things are available to you, so you don't have to etch anything in stone and walk away. Your board can attempt something here, and if it doesn't work, come back to the drawing board if you like. All of the choices, as I've noted in the memo to your board, exist for you. But again, time limit may be one of them if you want to look to see how it works and bring it back in a year, or as I said, triggers as to if development is imminent, through pulling of permits, et cetera, your board can determine to revisit the issue at that time. There are a lot of ways that you can do this. There's nothing in the law that says once you make a decision, it shall forever be so.
Thank you very much. Is that a pen up?
Yeah, but I think she was up first.
Supervisor Scott.
You know, Supervisor Sabatier, I fully understand your goal of wanting to stop dumping. I think that's on the plate of every supervisor that sits here. We're tired of it, and we want to solve that issue. And I know you brought up the fact that, you know, this is a county issue and we need to solve this. But all the meetings that I've sat in, when there's collaboration and groups working together and not silos, that's when we make solutions. So here we have a partner willing to partner with us to try to help solve it, or minimize the issue of dumping on this road. So I think we need to be working with this partner to see what we can do together to at least minimize the dumping on this road, and maybe the ideas that you're talking about
also go forth and do that also. But I think we need to be taking steps as we move forward to solve this issue we have here in the county.
I agree with that. We do have an option here, and if we say no to this option and there's no option, then, then the problem's going to get worse potentially. So I think we have the opportunity to collaborate on what's going to work, and it could, I think that we need to have triggers for if there's development, if permits are pulled. And, if we do develop a plan, with surveillance or something else that might be more effective, we could try that out. We could have a pilot program there. We could open the gate and see how that works for a period of time. And we have that option available to us now because we don't have those programs in our hand to offer the neighborhood up here that's having these difficulties.
Okay. And if you're ready for action or further conversation.
I'm going to see if we can frame something, Mr. Chair. I would like to make a motion that we do allow the gate to stay, but I would like to include in that motion that it is going to be either provided power or solar with the clickers for the community and also for public safety access and an opportunity for a review for the next couple of years, for at least every 6 months, just a simple check-in and see where we're at and how things are working. So I don't know, what that would look like. I know that's a lot of talking for a motion, but I would offer that as a compromise at this point, especially hearing that the individual, the tribal nation that put the gate up would be willing to work with us on that collaboration, so that's my motion.
I'm sorry.
I would just like to add a trigger if permits are pulled for development.
Okay. And that was in our correspondence that it was in there too, so I completely agree.
Ms. Grant?
Yes, just for point of clarification, 6-month review by whom? By your board, by the road superintendent, by, you want that to be by you?
Yeah, we made the decision, so it should be us, yes.
And when you say for the community, you're talking about the neighboring properties along Foothills Oak Drive?
Yes.
Okay.
Access properties?
Yes, the ones.
Access properties.
And I would like to, there's a motion on the floor. We're continuing discussion based on the motion. I know that Director De Leon was slightly concerned about how much staff time would be involved with keeping a list, keeping track of who's got a clicker. Do we want to ask Robinson Rancheria to take on that lead for us in that motion?
Yes, that is the intention of the motion that I bring today, that it would be fall on the tribal government to do that portion and reporting back.
Okay.
That's
Any further discussion?
Second.
Okay, we have a motion from Supervisor Simon. Hopefully somebody took notes of the details. And I have a second from Supervisor Paiska. Johanna, roll call, please.
Okay, Supervisor Simon?
Aye.
Supervisor Scott?
Aye.
Supervisor Paiska?
Yes.
And Supervisor Sabatier?
Nay.
Thank you.
Thank you very much. And let's go ahead and see if we can get Supervisor Crandall back here. Thank you. And our next item will be our 10:30 a.m. item. Thank you very much. And so item 6.7, 10:30 a.m., presentation of 2021 Drought Preparedness Clear Lake. And Director De Leon, I'll let you take this one over.
Good morning. Thank you for the opportunity. Staff has put together a number of pieces of information, and I should have asked for this before, but it looks like I can share my screen. So I'm going to, if you don't mind, I'm going to go ahead and do that. I apologize. You kind of snuck up on me here.
No worries at all.
Okay. There we go.
Perfect.
Okay, thank you. Sorry about that. So again, staff has put together a short presentation, and I'd like to share that with you. And then we have some additional, one additional slide I think that I'll share with you. And you know, this is the first of a couple of items we're going to talk about today related to the drought. And I'll just jump into the slide presentation, and please feel free to stop me if you have questions. This next slide shows our current water year precipitation. The two slides we borrowed from different region or different sources, and you can see the story behind both of them, that we are extremely low or below average or normal precipitation. Here are some of our historical, let me move this, some of our historical precipitations around Lake County. The average for the upper Cache Creek Basin, which is basically Lake County, is 37.45. We took some years around previous drought experiences, 75, 76, or 76, 77. You can see that we had two back-to-back years of significantly low rainfall compared to the average. We also had a little drought in 2014. And that is the last time your board made a declaration of drought emergency. And you can see the rainfall from that year. And then the last two winters, you can see the rainfall that we had. So 2021 certainly approached the rainfall amounts from the 76, 77 drought. Again, kind of comparing it to those specific years, 77, 2014, again, the average of 37, and that just kind of summarizes the previous slide. Also, Lake County or Clear Lake levels for those particular years. The 77 is a little challenging to see, but you'll note that you can see the graph of the lake level here got down to a little over -3.5, roughly, in 77. 2014, we got you know, below, not quite to -1, and whoops, sorry about that. And then this current water year, you can see where we dropped, and you know, today we're sitting at about 0.7, I believe. We have some predictions, and I'll share those with you here in just a second. We took a look at some of our groundwater levels using wells that we monitor. Some of these are monitored on a monthly basis as part of our CASGEM program, which is a groundwater reporting program through the state. And we've got a couple of, you can see this is one of the wells that we tested in its location. And we'll just kind of go through this slide here on the right. This kind of purple line with the X's on it is the springtime average. These wells, or this particular well, is likely a well that we evaluate in April and then again in October, which gives us the spring average and the fall average. So this purple line here is the average of the readings that we have typically in April, and you'll notice that this year is approximately 5 feet, a little over 5 feet below the average groundwater level for that particular well in the springtime. Another well, this one is very near to Kelsey Creek. Same type of information. Here's your springtime average. This blue line is a plot of the spring readings, and again we're a little bit below the average. I think one of the things that's helping that is you'll notice right below it are the fall average readings, and so we were much higher in our fall readings, above average over the last couple of years, which is likely helping minimize the amount that we're below the spring average. This is a plot of the Clear Lake levels, and I'm going to have to keep moving my, let me get that out of here. The current stage is this gray line here. The dotted line is the stage. These dots here are the stage from 1977, and then this solid blue line is a plot of the lake level from 2014, again focusing on the last 2 times that we had significant drought conditions. And then this is a prediction for this year. It's a little difficult to see but when you compare the solid blue line and this dotted blue line from the different years, 2014, the lake dropped at a rate that was much quicker than 1977. So what we've done is we've kind of corrected the predicted level based on the rates that we saw in 77 and the rate that we saw in 2014. And that gives us these green and black dots and the predicted elevation of the lake at the end of the summer. Here, this would be the first weekend in November, and we're predicting that it's going to be somewhere in the negative 1.78 to negative 2. So somewhere around negative 2 Rumsey is the anticipated level. This yellow dot is using a theoretical value or a theoretical equation. This is just another graph of the previous slide. This is some interesting information that staff put together. It is our public boat ramps. And what we did is we went out and using as-built information from plans, going to the ramp themselves and actually trying to measure down to the end of the ramp. We determined the approximate depth of the end of the boat ramp of a number of our public ramps. And so those are shown in this column here, the method that we use to establish that elevation and what's likely going to be the recommendation. Some of these are actually already closed, and these will be our recommendations for these ramps getting through the summer. And these are some of the resources that we used for our slides. And I'll I'll stop sharing. And actually, what I wanted to do was bring one more slide over, and let me share that.
Well, while you're doing that, I have a question for you.
Yes, sir.
In your previous slide, the yellow dotted line, which went all the way down to about -4 Rumsey, is that like a worst case scenario? How did that come to be? I didn't quite understand. The others were kind of using other trends from 1977 and 2014. What made the yellow dotted line?
So that was using an equation, and it takes into account evaporation, temperature trends, different things. It's a very complicated calculation, and it didn't really follow the historical trends, and so I think while it's a useful tool in helping determine or estimate where the lake may end up going, I thought it was important to include the historical trend, which was shown in 77 and 2014. And so that would certainly be worst case scenario. But I think the historical trends are probably a bit more reliable.
Okay, thank you.
This last screen, I hope you're seeing that. It says I'm sharing the screen, so
yeah, we see it.
I presume it's up. These are a series of wells in the Big Valley Basin, and these are the average water depths of each of those wells that we do in the spring. And you can see these were the readings from spring in 1977. These were the spring in 2015, and these are spring of 2021. These numbers down across the bottom are the average of all of these in that column. So you can see that on average, our wells are above the readings that we saw in the 76, 77 drought by roughly 10, 11 feet higher across the board. And they are a little bit below the spring levels from 2015. So,
is it possible for you on the bottom right of your screen where it says 100% and a slider to slide that a little bit bigger so that we can make sure that the public can see it? Because it is a little difficult to see. Perfect. Thank you.
You're welcome. So again, these are the historical or monthly averages of these individual readings here. Again, these are all wells that are in the Big Valley Basin. And so spring of 77, the average depth was this number. Spring of 15, the average depth of the water was this number. And again, this year, the average depth is between them. It's significantly higher than spring of 77 and a little bit lower than 2015. So with that, we will continue to monitor our boat ramps. Again, some of the wells in the Big Valley Basin get checked on a monthly basis. Most of them are done in the springtime, but the ones that we monitor on a monthly basis we'll continue to do. And we'll continue, as a department, we'll continue to respond to reports of obstructions or things in the lake as the lake level drops. And with that, I'll be happy to try to answer any questions. I also have Marina Delajanis from our department, Deputy Director, is here. So if you have any specific questions related to perhaps groundwater basin or anything of that nature as it is related to the drought and is contained within this item, we'll be happy to try to answer.
All right, thank you very much for your presentation. Any comments or questions from the board? Supervisor Crandall.
Yeah, and you probably explained this during I think it's the Clear Lake Public Boat Ramps page on the screen, and where your recommendations are for opening or closing them. Just maybe for the public to understand, and if it's been explained, I apologize. Where it says depth at the end of the boat ramp, it says like minus 5.3, for example, on 5th Street Lakeport, below Rumsey, and recommends that it's open and used in engineer's rod. However, in other areas, it's like 1 foot or 2 foot. Is it because of the structure, or is there a method to that maybe you can explain so they can understand why some of them are recommended to be closed?
Nope, you're muted.
Thank you. Sorry about that. One of the things you'll note is those two ramps in Lakeport are some of your newer ramps, are more currently constructed, and so some of the older ramps, some of the unimproved ramps, for example, Rodman Slough is an unimproved ramp. It's basically just folks have over time figured out how to get their boats and trailers down to the lake. So it's an unimproved ramp. A lot of these older ramps, the ends of the ramp are shallower, and so the depth at the end of the ramp is just a function of when the ramp was constructed, and they, as you noted in that slide, they all vary.
Thank you.
The other thing that I think is important to remember is, though the ramp might be at -3 Rumsey, you still have to have enough water, enough depth to be able to get the boat off of the trailer. One of the things, even though the lake isn't going to be at -3 Rumsey, we're not predicting that it's going to be at -3 Rumsey, the lake still needs to be high enough to be able to float the boat off of the trailer. So some of these ramps, if they're shallow, they don't have a lot of slope to them, they may become inoperable as the water levels continue to drop. And again, these are things that we'll be monitoring as a department.
Thank you very much. Any further questions? Okay, are we going to, Supervisor Simon, go for it.
Just want to look at Director De Leon as we look forward, because, appreciate the update and where we're going here. But with historical data that we have going all the way back to 76, and most likely there's more, but when we go in the drought situation, so when we say drought preparedness for Lake County 2021, are we looking at over the next 50 years for drought preparedness? Because I know, and this is the way I look at it long term, this lake has been here for, some say, 1 million years. It's going to go through, obviously cycles. As we do that, we're drought and other things. And my question really comes from, we have more on your Clear Lake public boat ramps that have been closed. We have more ramps that have been closed previously than are going to be able to stay open if it's a worst case situation. So my thought is for the long-term opportunity for dredging, for improving the ramps, because we are sitting here as a board right now dealing with this, but boards in the future, is there an opportunity to look at a worst case scenario and what we would need to do to extend our ramps as climate change and other things are affecting us for a long-term solution, even if there is the worst drought that we've ever been through coming down in the future, that we're prepared for that, because we've heard earlier today some testimony about dredging and opportunities where we're losing revenue. We know the lake is what draws a lot of folks here for that long-term preparation. I know we're talking about the drought now, but what it would look like to look at those long infrastructure needs to improving all the ramps so they could stay open, because this isn't the first time we've had a drought in Lake County, and not the worst yet, because 76 had even lower numbers.
Well, certainly planning for the future is something that we always need to be mindful of. You know, a little bit later in your agenda, you're going to be considering a proclamation declaring an emergency related to the drought. You know, when things like that happen, and especially when declarations are made at state levels, sometimes funding becomes available for other types of projects related to drought, preparedness, and related to you know, drought mitigation. So there may be an opportunity to do just what you're suggesting, and that is pursue some funding to look at these public ramps and what types of projects could we do, or what improvements would need to be done in order to make them so that they aren't closed during periods of drought and still provide access to the lake, because we expect people to continue to come to the lake. You look at Folsom Lake, for example, in the Sacramento area. You know, we watch a lot of news shows where people are walking around, and Lake Mendocino is largely dry. So we're expecting a lot of folks coming here to Lake County, and so perhaps there's an opportunity to go after some drought-specific type funding and look at projects like that for the future.
Yeah, well, I appreciate that we're having the conversation today in the report, because we look at it, you know, we're having the conversation all the time about, you know, even during disasters, you know, there's always opportunities to come out of it. And this maybe we want to look at that long-term opportunity for economic development, as you said. As things are happening around, we know this lake has been here for 1 million years. We need to adapt to it, not try to make it adapt to us. And, you know, I just think that long-term planning is something we can't miss out on right now. So I just bring that up.
Thank you very much. And I know I was starting to say something, but I forgot what I was saying. But I appreciate the charts. I appreciate the data and information. I know that I was on a call where all the water purveyors also listened in and to check in to see how deep their pipes are in order to draw water out of the lake for drinking water purposes. And I also know that the Water Resources has just been advertising that close to 60% of our residents here draw water from the lake for drinking water, whether it's through a private company, mutual company, or public water district. It's different throughout the lake, but that's a large percentage of our population that relies heavily on the lake. And so definitely keeping a watchful eye to make sure that things can keep going smoothly, but it will be, as Supervisor Simon mentioned, we don't know how long this will be, and looking at what opportunities do we have. And I think some of those opportunities have already been discussed, and some of that could include planting toolies again to help rebuild the coastal area, and working with the right people to make that happen. Let's go ahead. If there's no further comments, let's open it up for the public. Any comments from the public on this item? I see none in the room, and we have Frank. Please go ahead and provide us with your full name when you're unmuted.
Hi, my name is Frank Costner. I'm the General Manager of Canocti County Water District in the City of Clear Lake.
Go for it, Frank.
I just wanted to say, you know, I'm the General Manager of the small water district in the City of Clear Lake, Canocti County Water District. We're experiencing the potential effects of the low lake at this moment. As the lake gets lower, our pumps have a harder and harder time pumping from the lake into our treatment plant. And so I've applied for some emergency grant funding to actually help that and also to get an emergency intertie with the Lower Lake Water District. Lower Lake is served with wells, and we're a surface water treatment plant. So hopefully if we can get this emergency grant funding, we can get an emergency intertie with Lower Lake, so that if we're no longer able to pump water out of the lake, that we can supplement our water with the Lower Lake intertie. And so if the county supervisors do declare a drought or an emergency, that will help us. It will also help the messaging throughout the county. We'll be a united front with all the other districts that have declared a water shortage emergency, and help us get some grant funding, hopefully. Also, I just want to say that we have implemented our water conservation program. We do have a water conservation plan in place. Our stage 1 is a 20% voluntary reduction in water usage, and then the stage 2, which we'll probably be implementing later this summer, is a 25% mandatory water reduction. And so I just want to thank you for your time, and please consider declaring a water shortage emergency or a drought. It would really help the water districts throughout the lake. Thank you very much.
Thank you, and that will be in another item, and let's go ahead and finish this one first. If there's any further comments, please raise your hand. I'm seeing none again in the boardroom and none in the Zoom room. And let's go ahead and bring it back. Any further comments or questions? All right. Thank you so much for your presentation. Very informative, especially as we go on to the next item. Our next item is 11 a.m. items, 6.8, Proclamation of Emergency Declaration for Drought Conditions. And Sheriff Brian Martin is here with us to bring this topic.
Thank you, Mr. Chair. This item comes on the heels of a May 6th proclamation that I issued declaring a state of emergency in Lake County due to drought conditions. That proclamation came after an April 30th meeting that I had with several stakeholders in our county, the County Administrative Officer, Director De Leon with the Water Resources Department, the Public Services Director, the Auditor Controller, and the Special Districts Administrator. What you saw today was a presentation. Obviously, it's been updated since that April 30th meeting, but that was the same presentation that we were shown at that time. At that point, we decided that it was probably appropriate to go forth with a proclamation and make sure that the timing was right. This is our second drought year with no apparent relief in sight. We anticipate further drought conditions. There's no good news in the immediate future for any relief from this weather. And what we're anticipating is that we're going to have a very slow rolling emergency with this drought, with the impacts to be seen in various ways. We're already hearing some of them during the public comment on the previous item, and I think we're just going to hear more and more as the drought continues. Yesterday, the governor expanded his April 21st emergency proclamation. On April 21st, he ratified proclamations in Sonoma County and Mendocino County related to the drought. And his expansion yesterday included 39 additional counties within California, with Lake County being one of them. The extraordinarily warm temperatures in April and May separate this critically dry years from most other years in California record. A lot of the snowpack that we had in the Sierras melted very quickly and absorbed into the ground rather than flowing into the watersheds and the waterways in the Sacramento Feather and American River watersheds. And those waterways feed the major reservoirs in the Central Valley, and they're feeling the impacts there as well. So what we're here today for is for the board to ratify my proclamation, and probably the question on everybody's mind is, so what does this mean? What's this going to do? As you heard one of the previous speakers, it opens up a lot of grant opportunities. It opens up awareness opportunities. The Office of Emergency Services is going to start a campaign with SaveOurWater.com, pushing notifications out and information sharing to try to get that voluntary compliance that we need. I plan on convening meetings as early as Friday this week with some of our stakeholders, with Water Resources, Public Services, special districts, city and tribal representatives, fire officials, agriculture, cannabis industries. We'll invite everybody to the table. Hopefully we can get as much representation at that meeting as possible, and discuss strategies and suggestions and review Chapter 28 of the Lake County Code to see what already exists in our ordinances to address some of these matters. Plan on reporting back to the Board of Supervisors next week and on an as-needed basis, and request that this agenda, if it's ratified, that the agenda item be continued on a regular basis as the other emergency proclamations do, so we can keep on top of this and hopefully respond to what is probably going to be an inevitable, long, slow-rolling emergency. Again, I would hope that our emphasis is on voluntary compliance, as Supervisor Simon pointed out. With every disaster, there comes opportunities. I don't want our actions as a government to be immediately jump to punitive actions. We want to seek voluntary compliance and look for those opportunities that we can reach out for those grant fundings and take advantage of things to maybe extend the ramps out. One thing that seems to be very common in society today is equitable access to our public lake. For a lot of people that can't afford to live on the shores of Clear Lake and have access to their own private boat docks and boat ramps, the only way they can get out there and enjoy the water that they're legally entitled to enjoy is by way of these public boat ramps. And if during drought years they're going to be shut down and deny them access, this is a great opportunity to get those ramps extended so we can continue to provide that recreational opportunity for people. That would be good for our economy, and it's good for people to be able to enjoy what they pay for with their tax dollars. We need to, during our meetings, we need to discuss what the impact's going to be to households, to the business, to our ag crops, our livestock, recreation and tourism impacts, our municipal water supplies, our groundwater supplies. One thing that comes up that's very near and dear to me is our emergency response. Already at Brado's Marina over by Buckingham, where we store our boats, it's getting too shallow for us to use the majority of our boat slips that we ran out there. This is particularly of concern during the North Bay complex. We actually deployed our boat patrols to go and save people off the shorelines of Clear Lake. And if we're not able to access very quickly, hopefully we never have to do that again, but that may impact our abilities to provide those emergency services, as well as the routine emergency services for stranded boaters, boating accidents, and people in need of assistance on the lake. We need to consider the impact that this is going to have to staff response costs. With this, if the board does decide to ratify this, I'm sure you might hear from the auditor controller that we need to track our expenses so that we can be able to obtain any reimbursement that's available as a result of this. We also need to consider the impacts to our tribal lands. During previous droughts, we had people that took advantage of the receding water lines to try to exploit for their own personal gain some of our cultural and historic resources in and around the lake, and include the various tribes around the county in our discussions so we can meet their needs as well. In closing, I want to encourage the board to ratify this proclamation. And I also want to thank the various people that helped out with this. I can't name everybody, but already up until this point, I've had a lot of help from some of our county executives, including the Water Resources Director, the CAO, the Public Services Director, the Special District Administrator. And again, I'm not intentionally leaving anybody out, but there's a lot of people that had a helping hand in this as of right now, and there's going to be a lot more that continue to help. Thank you.
Thank you very much. Any questions or comments from the board?
Yes.
Supervisor Pyska.
Thank you, Sheriff Martin. So just to be clear, this is the sort of the beginning of the conversation. It's not, these aren't triggering mandates or anything yet, but this is the start.
The resolution that I proposed for ratification today does include the ability for the Public Services Director, the Water Resource Director, or the Sheriff to close boat ramps without further authority. As you see, we've already closed some of them down. I think that by all means we have the ability to do that when conditions aren't safe, but you're exactly right. This is the beginning of it. I intend for this to be an ongoing conversation as things come up. There's no way to anticipate at this point all of the impacts. The only thing we can anticipate is that we're going to have impacts, and we want to have a continuing and ongoing discussion so that we can focus our efforts where we most need to in response to the ongoing emergency.
Great, thanks for that. Yeah, I was reached out to by water purveyors wondering, does this mean we have to start fining people? And we're not there yet.
I would hope not. I don't want this to be punitive. We want to seek voluntary compliance. I think everybody understands the importance of it. And there's little things, as I said, our messaging campaign with SaveOurWater.com. We're going to be putting those messages out. I think it's a lot of stuff that people already know. To be able to save water, they can certainly measure whether or not those efforts are working by measuring the amount of water that's getting used. And let's give that a try first before we start punishing people.
Thank you for that clarification.
Thank you.
Any further comments or questions? I would just like to add that, and it's been implied, but I just want to make sure it's verbally stated. Nobody knows exactly when the weather will change. And so this may be this year, we may be starting today, or as of Friday, but we don't know if this is going to be a 2022 drought, a 2023 drought, and so we need to think about the long term because we have no idea. So we definitely need to be mindful of that. Let's go ahead and open it up to the public for any questions or comments. Anybody in the boardroom have a question or comment? And if you're in the Zoom room, please press the raise hand icon on the bottom of your screen or dial *9 if you're calling via phone. All right, seeing none, let's bring it back to the board, either discussion or action.
I will offer the resolution proclaiming declaration of a local emergency due to drought conditions.
Was it a resolution?
Yes.
Okay. The resolution has been offered. Johanna, roll call, please.
Okay, Supervisor Simon,
Yes.
Supervisor Crandall,
Yes.
Supervisor Scott,
Aye.
Supervisor Pyska,
Yes.
and Supervisor Sabatier.
Aye.
Thank you.
I will offer the resolution proclaiming a local emergency and requesting the governor to make available state assistance funding and seek all available forms of federal disaster assistance and relief programs to include residential declaration of emergency.
Resolution has been offered. Johanna, roll call, please.
Okay, Supervisor Simon,
Yes.
Supervisor Crandall,
Yes.
Supervisor Scott,
Aye.
Supervisor Pyska,
Yes.
and Supervisor Sabatier.
Aye.
Thank you.
Okay, that takes care of that item. Thank you, Sheriff, for bringing that to us. And it is 12:30 p.m. We have an item coming up later at 1 p.m. And I was thinking right now would be an opportune moment to take a lunch and come back at 1:30? Or would you like to come back earlier at 1:15? Preference? Okay, I'm going to say let's go ahead and come back at 1:30, give staff an hour to take lunch, and then we will reconvene at 1:30 p.m.